How's it going?
All right.
You look tired.
I do. I feel it. This is my third networking event in 2 days.
Wow, that's a lot.
Yes.
It drains you, right, when you network?
It's not just the
'Cause you gotta-
networking. I was up late.
Yeah.
I was up late. I was like helping with the one last night,
Mm-hmm.
and then I had one today, and then there's just the second one today.
That's good, man. That's good for you.
Good, lots of good starts. I need to make sure I can continue. So you might not see me for another couple weeks after this. Tell you what I'm gonna do. I'm gonna go on vacation. Not next week because I need to clean up from these networking events. But the week after that, I'm just gonna be gone.
Sounds good.
So, hey, Cal, have you made any progress with your OP thing?
Yeah, unfortunately, we missed the grant.
You did.
Yeah, and we found on the last minute it's only for for-profit companies, and we missed that. But there's another grant, the Bed Finder grant, and we're working on that.
Okay.
Yeah, we'll be happy to share more details.
Because I know, I know you get some email off to Amit.
Yes. Yes.
He's coming back next week. If I'm mistaken. I think on the 23rd from now.
Yep, we'll chat. So, all right, go ahead. You're live.
You're better off putting it in one place and moving it.
No, I will turn it
You're
around.
gonna turn it
As
around?
Usually
usual.
we're on the other side of the table.
Yeah, I'll turn it around.
It's just usually you're on that side and he's on this side, and it's like
Sure. I'll go on that side.
you don't have to. There's no reason to.
You need a computer to turn it around. Who's going to turn it
There's no
around?
reason to do that. It's just
Ben is a habit lover, so he just.
He's uncomfortable. It's not.
how are you supposed to iterate if you don't do it again?
Hey, Cal, I'm going to grab a seat down there, so I don't think I'm on camera.
Okay, sure. Sounds good.
So it is leaving pretty down there. Or down up.
We'll put it up here.
Which way is up and down in this case?
See, he doesn't want to be in the camera.
Oh, yeah.
Oh, well, if nobody down, I'll sit up here.
Sure, yeah. I'll put it down here, so I'll sit over there. Because some people want to join us virtually. They couldn't make it, and they want to join the conversation.
How is going to be there if the camera is on me?
No, don't worry. It's on this side, so don't worry. I'll sit over there.
You know what? The safest place to put it, if you don't want to be on camera,
It's to sit right
right
here.
behind it.
Yeah,
Then
Why don't you operate
go
the
turn.
camera?
exactly.
turn
Why don't you
right.
operate the camera? That's
Yeah.
a great idea.
You can say wherever you want, but you can
It
operate the
is,
camera.
you make sure it's pointing at people who are talking, and then you're never in the picture. Your voice might be if you want to participate that way.
Fair enough.
Fair enough.
If you ask something, you get a job assigned to you. Unfortunately.
All right, let's get started.
Okay, let's start. Let's start, and people will join.
Where's Wilson?
It's not a job, it's the control.
Huh?
Okay, it comes with a job.
It will come. People will join as time goes on. So, I don't know how many of you, this is the first time. Okay, wonderful. So, some of the other people may already have heard the prelude, and I just have to repeat it for the normal purposes. So, welcome to Health Innovators. This is one of the events we call Open Forum. The way it works is that the people have a chance to just discuss, brainstorm anything they want, basically. Your ideas, your thoughts, what you want, and share it and get feedback. And if somebody talks about it, you can give a feedback. It's a very open discussion. What's the purpose of this? This is designed for primarily for entrepreneurs. People, when I say entrepreneurs, I talk about the person who wants to be an entrepreneur rather than a person who is already an entrepreneur. Already a person who is an entrepreneur knows what exactly the value of this, and they join just as well and do it. But people who are wanting to be an entrepreneurs, but they don't know how. A typical, I know, all of us were in that state sometime or other. Okay, so basically, you say, I have an idea, I'm excited, I want to try it out. And this entrepreneurial bug can affect you anytime, nobody knows. And then you think about it for a few minutes, maybe tell your parents, family, somebody, say, I want to do that, but then you forget about it. You simply don't do anything about it. You get busy with your work and all the things normally. You don't think a lot more about it. Periodically, it's a nudge when you're bored or things like, hey, I want to do something, or you see somebody else doing, I want to do it. Something like that. Periodic reinforcement, but not very formal. Suppose something goes wrong with your job, you lose a job or you got a lousy manager, you say, no, I want to get out of here, I want to start my own job. Gives a little more push. So that kind of attitude is where this particular thing will come in. So this gives you the next level of push, basically. But this is not a push in a negative way, it's pushed in a positive way. So you come here and you think about that idea, that elusive idea that you had in mind for a couple of hours. Talk about this with a friendly audience. And you express what you're thinking about. It's half-baked, it doesn't work, it could be any number of things. Okay, you haven't thought through the whole idea, but that's not exactly, I mean, that's the point. You don't need to have thought through the whole thing. You share your idea and you talk about, get the feedback and get that little more insights from other people. We get a lot of people who have years of experience in the healthcare. Kalyan is a physician and he knows what exactly happening. I've been there doing this for 5 years, and there are other people who have experience with innovators, I mean, healthcare actually, and all the other aspects associated, whether it's writing a EMR, EHR software, or if it's an IoT application, or if it is a physician who knows that particular area inside out. We get lots of people. And you'll get the input about it, and you'll get a better understanding of it. You'll also know who is excited, who is interested about it. The idea next is, after this, is to build a team. The most important thing in any startup is the team. And we help you build the team. And we do it in a very organic way. So this meeting is the first meeting where you get a chance to talk about it and see what happens. And if you are still motivated and is still interested, there are a series of other activities that I wrote on the board, but I'll go over it in a minute, that will allow you to take step by step that process and how to build a team, how to get the team together in a very organic way. How else can you find the group of people who can support you? What kind of things you should do? And we go through the process. All the events are free. All the events happen every week, every particular day of the week. So you're welcome to come. And in fact, most benefit happens by people who come again and again. Because next week, maybe other set of people, we don't know. So it's not like a one-day course and you learn it and you go away. It's a networking event. And it's a networking, unlike other places like Venture Cafe, where 100 people sitting there and you have to find that one needle, one person who is compatible. Here, it's a very quiet, low-key, and you get a chance to talk here, and you get a complete way of networking. So that's what we provide. And the only one caveat in all this is the intellectual property. We haven't signed, nobody is signing any NDA. And what we ask you is to act as if you have signed an NDA with people. As a gentleman's NDA, as I call it.
Oh, so don't take someone else's.
So yeah, exactly. If you find somebody's idea very appealing and you want to do something, join with that person. Don't compete with that person. Don't go off, take the idea and try to do it on your own. It's a lot more fun and profitable to work together with people. So that way you share the resources and you can make two. Is 1 + 1 is definitely greater than 2 in this kind of a situation. So we ask you to, when you hear somebody's idea, respect that person's intellectual property, contribute to it. If you think really want to be a part of it, meet with the person, talk together, make the good chemistry and work with that and make it happen, not compete. In that spirit only people are sharing information. And you can also expect the same thing when you share information. You can expect other person to be genuinely interested in what you're doing and support. And if they come and ask you to work with you together, find ways to work together. Okay, so that's the model that we will be doing. Fine. So in that context, we are offering a series of courses, and these are all came by our experience over a period of time, and we are constantly making changes to that. And some of the courses on the board, maybe point out to that board. Okay. So the courses that we have are, first one is the open forum. This is for the ideation and brainstorming session. That's for 6 to 9 in this room. Followed by a course on Monday, which we call evidence-based entrepreneurship. Also, another way of saying it is how to start a startup. So you have your idea, what next? What do you do next? In that kind of situation, we ask you, we give you a model by which you can you can develop your value proposition, and we give you a series of steps that you can take initially to fine tune that decision, that value proposition and the customer. You have to do many things in a business startup, but some of them are more critical initially than others. You don't have to run to a VC to get money, even though sometime down the road you'll be asking for VCs. What is the idea? Who is going to buy it? Have you talked with them in person? Those are the three things. So basically, you have an idea, you brainstorm with people, friends, whatever it is, you come up with this set of ideas called value proposition that you're going to offer. Next question is evidence. Find it. I mean, closely connected with that is who is going to buy the product. If you build something, who is going to buy is the next logical question. And connected between the two is the evidence. How do you collect evidence? What do you mean by evidence, and how do you collect enough evidence for you to have confidence in your value proposition? And how to do that is the main idea for the second course. So we call it, it's a business plan you develop, but it's a business plan that you write is not a typical business plan in a school that they will teach you for 40 pages or 30 pages. It's a very abbreviated, to the point kind of thing, just one page. The third one is a digital marketing activities fundamentals. We take different activities related to digital marketing. Last week we had, yesterday we had Facebook chatbot, how to write a Facebook chatbot. It's a technical, and it'll technical and marketing. Basically, we pick contemporary topics every week, and it'll change every week. So look in the event, right, or meet up, and if you like it, sign up for us. But it will change.
Yeah, let me talk to you a little bit about that.
Sure.
So, so far what we have held in digital marketing is we've held introduction to digital marketing in the month of June. In the month of July, we held sessions on search engine optimization. And from next week, we're going to hold sessions on Google pay-per-click and Google Analytics, primarily AdWords and Analytics. Try to see how your marketing campaigns are running on Google AdWords campaign, and how to see the effectiveness of them, and how to target your audience and things like that for the next month.
Okay.
Yeah.
Then, following that, we have all this will be held in this room on 6 to 9. We also have Tuesdays and Fridays. We have planning courses which are more technical in nature, probably data science and stuff like that. We are in the process of working on it, and we will be offering more. So look for those courses if you are interested in technology-specific courses, and if you want to teach any, then we can give you a forum for that. So there is time and place available for that. Now, the other last two are basically hands-on kind of activities. On Saturdays, we have hacking. So basically, we have the full day available on the 4th floor, and people come at different times, and the ideas that you generated in the first day on Thursdays or other days, as you start forming teams, the teams can come together. It's not a very specific time targeted. People come as they wish, so to speak. Some people may be comfortable, they come at 2 o'clock, some people at 10 o'clock, whatever it is. And it is up to the teams to pool and get and access the resources that we are offering. So a lot of us, me and Kalyan, are always there, and other people are there as well. So they can present what they have done, ask questions, get input, maybe even do things, because of the breakout rooms, they can work on it, and there's resources available for them. So we provide all that. And it's an experience for team building and MVP. So if you have a team, as people come in, ask them to come. If you're, for example, if you're building a business and you have a team member that you say, okay, you want to work with them, you come, ask them to come on Saturday to that place. They can sit down, they have an office, they can work, and 10 to 4, 10 to 6, and you can, any questions, we can immediately get resolution. So you dedicate once a week, basically. But you can do other days wherever you want to meet. But we make the space available one day a week. We also have practice sessions. We'll be doing this week Python, and like the Facebook chatbot that was done yesterday. People can come in and practice it. So the persons who taught the course will be there usually, and they will be able to guide if you have not done during the time of the regular presentation. They can practice, learn more, learn. Basically, try out all sorts of things. So we provide a hands-on training model at that point, and it's up to the individuals. The resources available, but we don't really dictate when and where. Some people come there, stay the whole day, and they benefit by it. Sometimes people don't get comfortable, some people don't come. As we see it, the motivation of the person on the team working on the project is the important thing. For it gives us a guideline or a guidance about how serious these people are. Not everybody is serious. When who say that they want to start a business, many people drop off. They don't do it. But some people do continue. They take interest, they take motivation, they take the step by step. And those are the people who succeed, the perseverance. I used to say that entrepreneurship is not like a race, it's a marathon. It's a slow step, methodical step. You don't make progress for a week or month and then you make progress. You keep at it slowly, steadily. So those people, those teams which have the perseverance and the tenacity to survive are the ones who eventually make that business. So we try to give the kind of resources available for them so they can continue to work on it. What is the benefit of all this? At the end of it, if your team, if your company is in a good shape and willing to come by and actually do things, we are part of our incubator's ecosystem. And at some point, what we get in exchange for that is three things we take. When the company is formed and moving forward, we take 10% of the equity as a part of the incubator stuff. We ask for one board seat in your company, and we ask for $2,500 cost annual fee for that. And that usually is deferrable. Basically, if you are not making money, we defer it. We are not anal about it. But if you're making money, we provide that. All this money, all this equity, everything goes to help and support, not support, it goes to the people in Health Innovators who are volunteers. Health Innovators is a nonprofit organization. There are a lot of volunteers who work there. They made the database available. They made the resources available for this. So we are using that. So when you suppose you're doing a diabetics medication, something like that, and you want to test the medication in a real hospital setting, we have people who are working on diabetes, so we can connect them, or cardiac recovery, whatever it is, right? EHR, EMR. We have almost in every part of the healthcare, we have tentacles and we have connections we can pull on. So all these things happened because for the last 5 years, Kalyan and his volunteer staff did that, maintain the relationship. So the money, the 10% is actually going to a pool of money that they all basically get ownership. So you don't have to negotiate individually. You don't know which volunteer did what that you benefited, but a common pool gives us access and we all grow together. So that is the model that we are built for the incubator. But that is the later stage. But in the initial stages, there's no agreement or anything. We want you to grow and we want you to succeed, basically. And then we want you to be fair about it. Fair enough? So that's a general prelude. What we will do in this is an open discussion. We'll go around, introduce ourselves for about 2 minutes. In that, you tell me who you are, what you have done, what your background is, particularly with respect to entrepreneurial interests, what kind of things you want to do, what kind of things you're expecting from this group, what kind of benefit we can provide. As clearly as possible, because we have people knowing what you want will be able to help you, or we may be able to connect you with that. So we go through that during the time. Initial discussion, really no much dialogue. It's one way. We just share it. We go around. Once we know everybody's, then we open up and we have a free discussion of everything. Okay, so that's how we do. To start, my name is Mohan Venkatramana. I am a technology entrepreneur. I build products. My focus is product development, build products, go to market, make money. Basically, it's build and develop whatever it is. And I work on multiple verticals, including healthcare. I've been working with Kalyan for about 5 years in Health Innovators. And the last 1 year, also in doing all these events and planning what needs to be done. And I have some background. I'm a chemical engineer, telecom, plus software development, hardware development, design services, etc. That's what I provide. Okay, go ahead.
Keep turning that. Good evening, everyone, and welcome to Health Innovators. My name is Cal, and I'm the founder of Health Innovators. I'm a physician and a pharmacist by training and education, and I worked in information technology for 12 years for corporate America here. And 5 years ago, I got my green card, and that gave me the opportunity to pursue the things I love. And for the past 5 years, I came to America to make a big impact. I realized that I've tried it on my own, and I realized that I can't do it on my own. I have two failed startups under my belt. I figured I work with a lot of people, and hopefully that way we all can join our forces and make a big impact. And that's the reason I started the Health Innovators. We're trying to provide as many resources as possible to everyone so that we can work with as many people as possible. My motivation is to work with 1 million people, and we want to empower everybody and share the success. And hopefully together we're going to make a big impact in healthcare. So that has been my motivation. And my recent motivation, in the past 8 months, I believe we've been starting this incubator program. I feel that it's kind of going very slow. To fasten this, what we're trying to do is we're releasing our Health Innovators Cloud platform. The vision of this is for people to build apps. It's just like an app store, and we want to be the largest healthcare app store in the world, and that's going to be the first nonprofit app store in the world. So we want to empower entrepreneurs to build apps on our platform, and what our platform will do is it will connect you to the patient's medical record. So whatever your app does, you can transfer the data into the patient medical record, or you can see patient's data from the app itself. So that's the value proposition. Through our API, you can transfer and see data. So that's what I'm focused on right now, and I want people to build apps, and we're trying to build a developer community. That's where we're hosting a lot of events. And hopefully I'll see you again, and hopefully we'll work on a solution together.
My name is Matthew Stewart. I am a recent grad from Northeastern, studying behavioral neuroscience. I don't know what I want to do. I'm trying to figure that out. I was encouraged to show up and check this Health Innovators out by my dad. So that's why I'm here.
You said you have behavioral science?
Yeah, behavioral neuroscience.
That's a great area.
Yeah, very big market. Yeah,
What's that?
that's a big market. For
Big market. Behavioral neuroscience, what exactly did you do?
Like what jobs have I done?
No, in the sense, what was your education? Talk to me more. Talk to us more about yourself and the education side.
Okay, so I did a lot of chemistry courses. I did a lot of bio courses. On the neuroscience side, I have a strong background in understanding how signal processing or signaling occurs in the brain.
Sounds good.
What else?
Sounds good. Thank you.
I've got some psych background.
That's good. That's good. All right.
Have you finished it? Have you done with the courses? Or-
Yeah. Yeah, so I've got my BS
It's just now. Recently.
in May.
Okay. Sounds good. Thank you. Thank you, man.
I'm Viren Shah. That's VIREN. Got it. I am a scientist, marketing, sales professional. I have not reached the retirement age, past retirement age. I'm trying to discover. I'm still young. I want to be 100 plus.
That's good.
So I need to do something with my life. I'm not too creative in terms of my making one business idea, but I'm a good facilitator. If I have someone to work with ideas, I can get things done.
I see.
Because of my science background, marketing, and sales of 20 years in diagnostic industry.
Fantastic.
So I thought this forum will give me some introduction to somebody where I may click and say, hey, maybe I'd like to work with you. So that is my hope and desire and goal.
So you're focusing on sales? Or
Sales and marketing, yes.
Sales and
That is one skill we are always looking for.
Yeah.
Our
Because like-
entrepreneurs,
I am looking for specifically people. Yes.
I suddenly found a consulting job out of a company, diagnostic company on the West Coast, calling a pharmaceutical company for leukemia treatment. You know, where you have a companion diagnostic, where you identify what patient to select, which will be more successful with a specific therapy, and then monitor and evaluate. So begin to do some consulting work.
Yeah. So frankly speaking, entrepreneurs get excited about building solutions, and as soon as they build the solution, once they go to market, that's when they realize, oh boy, it's really hard to sell. So,
Yeah.
Okay, so yeah. Hi everyone, my name is Hong. So I'm currently a pharmacy student at Overmars College of Pharmacy, and at the same time I'm doing a bachelor degree in business administration just to pursue my healthcare business. And my interest is in healthcare innovation. I'm sorry, healthcare automation, especially in retail pharmacies. So like my vision for like retail pharmacies in the future would be automated. Yeah, by robot. Yeah, machine. So to help the businesses like achieve highest performance, as well as like they provide like, the best a better healthcare to patients. And I'm currently with my team building a smart pill counter. For retail pharmacies. Yeah.
what are you building?
Yeah, a smart pill counter.
Smart what?
Pill counter.
Oh, okay.
Yeah. I'm
Gotcha.
sorry.
No.
Yeah.
Goes away.
Yeah.
So yes, we're helping Hong. He's one of our startups we're incubating right now.
Yeah, we're working. He's been meticulously coming in. It's one of the success stories.
Yes.
So
That's who I am.
Hi everyone, my name is Andres. I'm a Venezuelan med student. I study medicine in Venezuela by this moment. I'm in Boston just for a couple of months. I saw this meetup app and I
from
wanted to
Minnesota?
come here.
Did you say Minnesota?
No, Venezuela.
Venezuela.
In Venezuela,
Okay.
yeah.
Okay.
And
He's a physician, a medical student, right?
I'm a
Okay.
student, that's right. I'm currently in 4th year
Yeah.
right now.
Good.
And yeah, one of my biggest dreams is after I graduate, maybe I want to come here and make the residency, look for a career here. But I also know that as a physician, you need to know also business. You need to mix the art of be a physician, the science of being a physician, and you need to know how to handle the money and how to work with it. And for me, it's amazing to hear you guys because you have experience with business. I don't have any experience with business. Maybe the only thing is that recently, because I wanted to have some money in my wallet, I started making a beard oil, for beards. So I mix it with, I asked some pharmacist about, hey, if I mix this oil with this, maybe this works, and look for in my knowledge of medical, I start selling it, and right now I have the brand, but it's kind of stuck because I'm here in Boston, but maybe after I can, with the knowledge I have with you, I can continue doing that.
Fantastic. Welcome.
Hello, my name is Benjamin. I'm a recent graduate. Hello, again. I'm a recent graduate from University of Pittsburgh, bioengineering with a concentration on medical product design. I moved to Boston basically to look for a job. Most of my experience is lab experience, and I'm here to see if I can help one of these startups or possibly start one of the ideas on my own. So I'd like to help someone off first. It seems like the
Easier one.
yeah. It seems like a more solid way to get started.
So what did you do in lab? Like lab experience, like into the field, like medical devices or like laboratory skills? Like
Well, I did some mechanical testing on bones and cartilage. I did a little bit of tissue culture, and I helped build a mount for an OCT, or at least one of the renditions of it. And it ended up being that project was too big, so I ended up doing a few other things as well, assisting with some of the preparation of the samples and such.
Go ahead.
A lot more.
Yes.
So my name is Hirsch,
Hi, Hirsch.
and I am doing research for an economics policy book Hopefully, I'll have that done by sometime next year. Figure about a little over a year to finish writing the book.
Sounds good. Thank you, Hirsch. I'll put a piece of paper under the laptop so it doesn't leak. Right?
Yeah, I think you're right.
Thank you.
I'm
I guess I want to ask you a question. You're a medical student here?
Here?
No, in Venezuela.
Venezuela, but what are you doing here?
Is it?
Just visiting. You know, I came here 2 months to learn some to improve the English medium a bit, and to know the city, know the health system here in the States.
So how much exposure you have to the medical system in America?
Oh, barely nothing. I mean, I just asked some doctors from the MDH, Venezuelan doctors, like, hey, I want to meet you, but it didn't work out. So barely nothing.
To the extent you can, given the fact that you don't have much information about the current system here, what's happening in Venezuela or other places in the medical practice, and how does it differ? You don't know much, I understand, because you don't have any comparison points, but in your opinion or in your experience so far, how different is it in Venezuela practice? Is it significant? Is it same? Is it?
For example, in Venezuela, we have 2 different health systems. We have the private sector and we have the public sector. And in the public sector, barely doctors don't earn nothing. They just work for what they do. And it's run by the state. The state has these big hospitals, and doctors work there, and they just sometimes you have to make the residency there because they are the ones who are attached with the universities, and that's a public sector. And we have a private sector ruled by entrepreneurs who want to build their own, maybe a lot of physicians want to build their own clinic and start working there. And of course, as Venezuela is right now like a split society, and some people that have the money can go to the private sector and take the healthcare there. But if you're not, maybe you just have to take the public system. And if you're lucky, you will have a nice doctor that will like to attend you and work with you and maybe cure you. But if you're not lucky and really can't do anything, and of course, the situation in Venezuela is really bad, so the state is not giving enough money to the hospitals, so people are dying there. I mean, are dying there because they can't find maybe medicine for their hypertension. That's it. The thing. Yeah. Hypertension. Hypertension. Sorry, hypertension. Yeah, I was thinking. Yeah, for that's an example. Or maybe they can find digoxin for their cardiac insufficiency failure, for the cardiac failure, and yeah, that's really bad.
So
But
medicine for hypertension and foxglove for heart, is that?
Yeah, for heart failure. I said digoxin. I don't know if you have the same here. Digoxin. I think it's yeah.
It's the same as foxglove. It's just they have different names.
Perfect. It's just an example.
Digoxin.
Digoxin. Okay.
Yeah. I don't know how it's. Yeah, I don't know how it's I don't know how it's pronounced.
I can Google it, but that's
Yeah, sure.
So, but anyway, I mean, whatever the medication is not available for the problems they have.
Yeah.
Well, that's a very cheap medication.
Yeah, but for everyday medication that is the one from hypertension, some people can't have it there, and it's because I don't know if it has to be with the fact that these public institutions are ruled by the state directly, and they have their own interest, and maybe they don't want to.
So how big
Anything
is
run
the,
by the public is terrible anyway.
I don't know you can make it.
Huh?
What about Canada?
Even in India, it's run by government. Boy, it's terrible.
I thought Canada had good public health care.
In UK, everything is government run, and it's pretty efficient. So you can make a statement like that. But you're right. Most of the time, government, because there's no accountability immediately, you can't walk out. the quality is usually less.
Yeah.
Is it the same in Venezuela?
Yeah, the quality is less.
How different it is? Like, what is the size of government, public health sector
Is
versus
that,
private?
real quick, is that more of a recent thing, ever since Hugo Chavez and
Yeah.
Maduro have come to power, or has it always been that way? Because I always thought Venezuela was pretty well advanced, going back 10, 15 years.
Yeah, maybe we have the last technology 15 years back, and our physicians are really well educated. I mean, still you have teachers and you have doctors that want to teach you their experience. They have foreign education, and sometimes the thing that happens is that the public system is also the one who run the universities.
I see.
So, for example, I study in the Central University of Venezuela. It's the main and the biggest university in Venezuela, and I'm associated with two of the biggest hospitals in Venezuela.
Okay.
It's the center, the hospital, university hospital, and the Hospital Vargas are the two main hospitals, and there you have really good physicians because they work in the private sector and also
I see.
in the public sector. They still are giving their knowledge to help people, but the problem is that they don't have
There's money.
not the money. They don't have the resources.
I see.
Okay, because maybe they have the money, but they don't have the appeal to say to the patient, "Hey, take it. Now you're cured. I know what you have, but I can't help you because I don't have the resources, and neither do you. You have
They
the
have
money."
the funds to purchase the correct medicine, but they don't have the seller contact.
The resources, like the pills are not like allowed to.
I don't know.
Yeah.
No, they are allowed, but they are not there because the state is the one that has to buy.
Control over
Oh, I see.
Oh.
The
Maybe-
money is there, but it's
So
someone
suppose-
else is doing the purchasing, and the person who's doing the
Suppose I
purchasing
go
isn't
there.
purchasing the right stuff.
Suppose I go there and I open a pharmacy
Oh,
and I know there's a demand for this medicine X, and I import and start selling it. What will be the response? Who will stop me from doing it in Venezuela?
For example, if you want to open a pharmacy there, and you will need to import
Yes.
the medication, right? The problem is that the dollars are controlled by the government. It's a really difficult situation we're living there, but the dollars are controlled by the government.
Dollars.
The dollars, yeah.
Okay.
If you want
Currency.
to buy
Donors?
Currency.
currency.
The value of the currency is controlled by the government.
Yeah, that's right. We have
Okay.
currency.
In many ways, Venezuela over the last, I guess, 5 years is not that far removed from the environment that you have, like in say North Korea or something of that nature, with government controlling.
I don't think it's quite
Everything.
that bad.
No, we're not that bad still. I mean, we still have Twitter. We still, we still have social media. We still are
Don't
allowed to
underestimate the
travel.
power of
But
internet connection.
we have to be aware. I mean,
But-
this is a critical moment right now. If we have to,
But
you have to check.
other than the economics, nobody is legally stopping you from doing it, right? If you want to say, I want to run a pharmacy, yes, I'm going to get money in Venezuela currency, whatever it is, right?
You can.
And
You can.
okay, you transact only in that, except that you need the medication you have to buy in the open market
Exactly.
outside the country, and it has to be imported. You could theoretically do it, notwithstanding the money,
Yeah.
and you can sell it. Nobody is going to say stop you. Nobody is going to force any rules
Nobody.
against you.
No, it's okay. But the problem is that for example, I want to sell
Let's say hypertension.
let's say a hypertension pill. I want to sell it, and I buy it here in the States.
Mhm.
I contact the
Pharmacist,
the pharmacist, and they sell to me a large,
Mhm.
A big crate.
and I start selling it
Mhm.
in a really high price there.
Whatever, yeah.
For example, because we have the black market, and of
Right.
course you have to. The only chance you have to take the money back you invest
Mhm.
is if you sell it.
No, that's not true. So you took a crate, maybe 100,000 pills,
Okay.
to that place, okay, to Venezuela. Now you can try to sell the maximum that you can get in that equivalent to black market money, but the money, whatever you make the money, you cannot take it out of the country because You need to
Yeah,
have
but-
dollars, right? So at most you can do is invest back in that country in some way. So you don't have to really make a huge amount of money. Suppose you sell it at a fair price, reasonable fair price that
On
people
the
can
regular
afford.
market?
On the regular market.
On the regular
because
market.
That's the problem.
Regular
On the
market.
white market or on the black market?
Not black market. Well, black and white, there is no black here. I mean, they will
Okay,
stop
so
it. They're
black.
not stopping me from selling it.
So my
So-
understanding.
On the open market, I should
I
say.
open market. So any doctor
You
prescribes
can't
it.
sell it that high because we have regulation with some meds. Okay.
That's
So
it.
what you can do, I mean, you can import drugs from India
That's right.
and sell it there. Why import from America? They're going to
See,
charge you a lot.
every medicine has a generic equivalent, right?
Cheaper.
There are countries which will make the generic medication, take it there and sell it at a reasonable price. Don't have to go overboard.
So rather than buying it in America, which is not super cheap, and then selling it in Venezuela where the price is
They,
capped, buy it super cheap from overseas,
Generics
like India or
particularly.
China.
and sell it. Okay, the idea
And,
is
Much cheaper.
see, I'm not
Much cheaper than here, yeah.
I am not getting into the economics or the politics. Get rid of that. Okay, don't worry about that. It's about people. It's about helping people get
That's
well, right? Because they cannot wait. Somebody who's going to be dead today is going to be dead tomorrow, even when the economic system changes. So forget about all that, right? You have medication. There are, as you said, there are medication sources available, particularly generics. Okay, because then there's no patenting rights, anything else. There are people who will make it, particularly if there's a demand, reasonable demand, they will make it. Take it and sell it at a reasonable price. So it may not be an individual, it may be a non-profit there. It may be combining with a non-profit in other parts of the world. So as to pass the medication so that the people are helped. Okay, so that way you're solving that critical resource problem, right? Why is it not, why cannot be, what is the problem in doing that model?
There's no problem. I mean,
Is there some? So if there's no problem,
why is anybody?
why does it not happen?
Let's get this one.
I don't know. I think people are afraid.
Are there any government regulation about import, export of drugs? Because
Maybe.
if the government
Yeah.
controls it,
Yeah.
even if you want to
if you want,
lie,
if you want to pass it
China or India, you
from the
can't.
shores, from the customs, it's hard.
It's hard, okay.
It's hard because you
But if
there
I
you have
do
the
it-
military like
If I do it, nobody's going to come and beat me up, right? There's no,
if you have the context.
Not
can
you
do it.
personally, but there's the other half of this.
Basically, black market. He said.
the black market may be, are they going to come back up?
Yeah, in
And,
public. Yeah.
I mean, so the
What is
problem, my understanding of the problem in Venezuela is really purely comes back to finances and the politics. I mean, I know for a fact that one thing that the Indian government did, because in India they needed large quantities of oil, and Venezuela is a huge exporter of oil, is they were trading prescription meds for oil.
okay,
But even that has come to a halt because Venezuela has not been able to produce the oil to export.
Because of the current political situation?
The current political situation has created issues for the refineries. So, like for the refineries
And the
with
prices
these,
of oil are down. So
so Venezuela doesn't have sweet oil. They have a lot of like really what's called heavy oil or and so and to be able to process that, they need to import a certain amount of the lighter sweet oil to mix with the heavier oil that they need to be able to refine the oil that they
Just never
extract.
get the refining process started.
And so they were able to, I mean, the refining process was fine for many years, but the current political situation has forced the refineries to not even be able to refine their own oil, even though Venezuela has like the largest oil reserves in the world outside of maybe Russia. And I think their reserves are even larger than Saudi Arabia. But that speaks to the political issue. So I know.
but again, we can try and discuss the political and economic situations. That is really a mess. And who is good guy, who is bad guy, why they did that. That's really too far away from a doctor who is trying to meet the needs of a patient. It could be his own or somebody else's, and they're dying in front of you. You cannot give them a reason saying economic system. is
Let's
good.
bring it back to the ground
So,
for a second.
but
So-
it's really hard. It's really hard that moment when you reach the diagnostic because you know how to do it.
Right.
And you can't help the guy.
Let's bring it back to the ground for a second and take.
That's really hard.
Yes,
So,
as a
I mean-
physician, that's terrible.
Okay,
So-
what if, I'm bypassing the political.
Who are you
economic
going to get
system
to actually
altogether.
sell
No.
these pills there with a
But-
situation that volatile?
What volatile?
Are the retailers on the ground going to be safe to sell these pills?
What Kalyan said is that pill that you're talking about, I think, is cheap.
Yeah, it is
Few
very
dollars,
cheap.
okay, a few
I'm
dollars.
not talking
Few
about
dollars. Wait a
whether-
minute.
It's
I'm not talking
generic.
about legally. I'm talking about people who are desperate or people from the black market coming and stealing your pills or harming your retailers while
Agree.
you try to set up shop.
See, that's what I'm saying. That's what I'm trying to say, where the
That
problems are.
Yeah.
And I'm trying to say, what if alternate solution, just to understand, not that we are going to go run and do it. Suppose there's a non-profit organization outside. Anybody who wants money, a pill of a type, all you have to do is send an email to this profit outside and we put it in the mailbox, take a package, put it in the mail and send it to them. How is the black market going to come against it?
So
It's just being mailed to them, that one little
They're
packet.
going to take it right
pack
out of
of
the
this.
mail.
This is a thing. I think that
They will, customs will.
Customs will, but
Yeah.
but if
And then
it-
all you need is
No,
one from
what-
customs office.
let them work
one,
on.
one of the things that are happening, and I don't know if you have heard about the protests going there, is one of the things that the opposition wants to reach is open a channel, a humanitarian channel to import these medicines that they're talking
They
about.
want to dig another channel?
no, like a
I don't know
distribution
how.
channel.
Oh, I thought you meant like a water channel.
No.
Panama.
They wanted to open the customs, to
Oh, I see.
to medicines come as you're saying,
Uh-huh.
but the government don't want to, doesn't want to. Like they think they can manage the situation.
So, I mean,
that is because they're trying to make a political statement that they are self-sufficient.
Yeah.
That is because if you create a formal distribution channel, that is attacking the credibility of the government. But one of the ways to break that up usually is not to make a big issue of the politics. Don't make it a religious issue of saying, if I win, you lose. Don't do that. Simply saying there is a patient who needs a bottle of this pill, 100 pills. Somebody, if suppose how much a person needs? Maybe 50, 100, whatever it is, let's say. Now,
30 is a nice average.
whatever it is. Okay. So basically, if my family is in Venezuela and my family member is in need of the medication and I'm in America, I'm not going to worry about it. I'm going to simply take this and send it by mail, or if I'm really interested, I'll fly over and give it to the person. That's what I would do. I don't care about the politics. I don't care about what the president says, what the international relation. I want my brother or sister needs that medication. I'm going there. I'm going to put 4 of them in my pocket and I'm going to walk in there.
There's an idea. Rather than selling it to the Venezuelans directly, you sell it to the family members they have here.
Take it
And
there.
then the distribution gets done on the family end of things.
That's a good one too.
Yeah.
so let me interrupt real quick.
Okay.
You really cannot, because the situation in Venezuela is horribly bad, and I don't know how to put it in words. I mean,
I have an
you've-
example.
No, hold on a second. But I mean, you've alluded to how bad the problem is, and so there's a situation where, government military forces were selling goods on the black market
Okay.
because they were controlling the supply of everything. The government
I see.
controls the supply of everything. So
Even on the black market?
That's what.
That's why it's-
Yeah.
That's surprising.
It is.
Usually the government tries
They
to
have
do
access.
more above the
So-
Why
surface.
is it surprising? They have access to
There
goods.
may be a black market.
But so if I can finish, if you don't mind, I mean they have controlled the supply of almost everything from toilet paper to baby formula,
Okay.
and we're talking about medication in which you generally need a prescription. So you're not going to be able to get the prescriptions here in the United States on an individual basis and then ship them to.
But you're assuming United States, but it can be anywhere. The whole
Okay.
world is there.
So let's take for example India, where you can pick up, or any maybe Eastern European country or some other country.
I'm talking generics, not even prescription of the brands.
But unless you're doing it on an individual basis, you're not going to be able to do it on a mass scale, right?
Right.
Okay. And so you're shipping the stuff there, and you're assuming that the material or the prescriptions don't get confiscated at customs. This can be done like on on an individual basis, but there's no way a doctor would be able to arrange that for 20 or 30 or, maybe even in a half a dozen patients. The process is not.
It would get too bulky to be able to fly under the radar.
Yeah.
Yeah, I mean,
Okay,
the
let
government would step in and control.
Okay,
it.
let me ask you a few questions on that. Just brainstorming, okay? Which is the adjacent country to Venezuela? What is the country next to Venezuela?
Colombia.
Colombia.
We
Okay.
have Brazil.
Okay. Let's say Brazil or Colombia. Brazil is actually wonderful. So yeah, go near the border, across the border, open a shop for all this medication. Whoever wants from Venezuela, walk over, come across the border, buy it, and take it in.
So
What are you going to do?
So
Right now,
Real close to
Colombia here. Brazil, yes. Because
That's what happens in America.
What is that?
Canada.
Which
yeah,
one?
there is a big jungle in the middle of Venezuela and the Amazon.
But do people anywhere go between the two countries? Roads, buses, something?
so here's
Go on the other side.
Brazil, yes, but Colombia, no.
Fine, wherever it is, go open a shop there, import all. If they confiscate 10% of it, 20%, let us confiscate. Okay, we'll get more, put more until the black market cannot survive and without scarcity being there. As soon as the whole amount of material is available, nobody's going to buy in black market because it's freely available. So black market automatically will come down because it's no longer profitable. But my goal is not black market. My goal is if I go across the state and if I'm opening a shop, okay, come on in, guys. If you are a poor guy, I'm not going to ship it to you. You take a bus, come here, buy whatever you want, and go back.
So
The
again,
government might check when they come back.
Pardon?
But the government might check them when they come back.
Check them basically. Okay, you're going to check them and confess how much of this medication are you going to keep
Now
picking
we're
up?
back on the family level where people are going to start doing crazy, silly things to get the medication.
In. It's their responsibility and they will do it.
Right,
If your brother desperately needs it, I'm sure you'll find a way to get the medication, assuming that's available across the border. I'm sure he will do it.
Start smuggling it like they do.
so again, we're not going to be able to escape
Why?
the political and economic issue.
Not going to be
One,
able to escape it.
Why?
because I've alluded to the fact that it has become the environment in Venezuela is coming closer and closer to like the environment that you have in North Korea.
That's okay.
And so what you have is you have the military controlling the borders.
Right.
You have the military controlling everything that gets imported and exported out of the
Right.
country. You have people that cannot freely come and go out of the country like you normally would any other country.
But some
And-
people can come, right?
And
But is that the exception?
And so, again, what you're trying to do is, unless you're really super wealthy, and there's not really a whole lot of really super wealthy people in Venezuela anymore, because the only people that are able to get what they need are people that are part of the government. For all practical,
I
for all intents and-
I understand your economic and political barriers, but I'm not disputing that.
And so like
We're gonna
suppose,
need
for
an
example,
advisor.
let's say you have a brother or a
Look
relative,
around the room. We're all med tech people.
and
Yeah.
so
You
you
need
have,
someone who's politically connected.
No, political there, but let's see.
We need a diplomat.
and so suppose, for example, you have a person, you have a relative
Right.
that is extremely sick,
Okay.
and you have medication in Brazil that would alleviate the issue, right? Okay. You would have to be able to enter Brazil and
Okay.
leave Brazil and return back to Venezuela.
Right.
There's no way you're going to get out of Venezuela into Brazil and back into Venezuela without being stopped by the military in
Oh, yeah.
Venezuela.
Yeah, they will. Of course, they will do. Across the border, they will check.
And
Granted.
that's not a matter of checking. It's a matter of, okay, you're being assaulted and beaten up. The environment is really bad. The only thing I can recommend for you to be able to understand how bad the situation in Venezuela is just go on the internet and take a look at the videos that have been produced.
Well, that might
By
be a
the
little
news.
sensationalized, but
But
I don't know how much.
But what
I mean,
no. See, I agree with you. I agree with
the
you.
inflation rate's close to, I mean, like, I think like
Let's move
7 or 8
on to the next idea because it looks like it's hard.
No, I don't see. If you have somebody else wants to talk about an idea, I'm happy for that.
But
Okay?
but
I'm trying to see how to break. There have been
We
more.
have so many problems here we can solve.
Legally. Tell me what problem you want to talk about. Tell me which problem you want to solve. It's on you, Carl. Take another. Okay, we discussed that.
I'm being very sincere about the issue. I'm being very sincere about the issue. If you're the average person, your money's worthless. The inflation rate's $700 to $800. Even if you don't have a problem crossing the border.
Let me back up. Let me back up for a minute. I'm not interested in solving the political economic problem, nor am I interested in solving. This is a hypothetical situation, but my goal in this is to understand what is happening in Venezuela from an ordinary medical person professional point of view. This is a healthcare, okay, health innovators. We're not talking US health innovators, we are health innovators in general. So I want to know what is happening in a healthcare, what kind of barriers the health professionals face, what kind of opportunities there exist in other parts of the world, and are there any connections that we can make, and can we help people in different viewpoints?
I'm going to use my computer here.
Okay, different viewpoints. Maybe something will come up, maybe nothing will come
Leave it
up.
on the table. This is good.
Okay, this is about problem solving. This is about brainstorming. Okay, so it is not trying to say we are going to go to that, nor are we going to say this particular forum is not to say, hey, we can't do anything, we give up and go home. That's not the idea here. The idea is to discuss, understand what's happening. In the process, we understood what's happening in Venezuela. I don't know anything about Venezuelan real system on the. I'm meeting somebody and I want to understand that, and I want to see what anybody can benefit out of that. That's all it is. It's not trying to go around trying to do illegally. I mean, if I want to push something illegally to a country, there are better than prescription drugs I can do. If I push drugs, I'll probably make more money with the support of the military for all that is. That's not the interest here.
So one of the
Go to Colombia. What's next?
Next, okay, let's go to Colombia next. Oh, we have a different story there, right? Aren't we? Go ahead.
Once the political situation gets settled, one of the opportunities which we can look at is plastic surgery in Venezuela. A lot of people, Americans, go to Venezuela to get plastic surgery. That's one opportunity which we can look at. All we got to do is find a bunch of doctors, put them on an online platform, and market it here.
Is plastic surgery the critical need then?
No, for Americans.
For America, but basically the short
It's
version
cheaper,
of
that's why they go there. Yeah,
It's way cheaper.
yeah,
It's cheaper?
yeah.
I see.
Yeah, a lot.
Yeah.
You can, for example, let's make you can take a whole transgender yourself. I mean, you can take a transgender surgery, complete full one for like $2,000.
What?
That's it.
It's really cheap. It's cheap.
I
Wow.
thought it was
And that's a lot
orders
of money there,
magnitude
a lot of money.
greater.
You see this? Here is the opening up of it. If you want to go to plastic
That's
surgery, I'll
amazing.
take along
You
with
can
you
put
a
a huge
few.
business around that.
No, take a few prescription drugs with
Just
you.
$2,000 sex change.
Take a few prescription drugs with you, sell it, and then have your plastic surgery.
So you want to piggyback the
Why
drug
not?
shipments in with
Why
the
not? It pays for your cost.
No, not with the doctors, with the patients who want to get the surgery.
Oh,
I have a question. Still here in the States, it's a big market, the plastic surgeries. This is still happening like really big. Like,
some subcultures.
or it's going down.
No,
like,
the thing is that many people want to get plastic surgery here in America, but it's cost prohibitive for them. These are the people who are looking at places like Venezuela, and
High quality
Thailand,
skier here, but
Brazil.
many
and
middle.
Brazil, and these are the places that you go to for nose job and things like that.
they just struggle for that.
What is happening now?
Yeah, medical tourism. Yeah,
Medical tourism.
medical tourism is a big industry. It's going to be big in the future, and that's one thing we can work on if you're interested. All we need is a website. Put a bunch of doctors and market it here and see.
They want to do the digital marketing for.
Yeah, we can do that. Digital marketing. That's all we got to do. And then we can charge percentage for the doctor. The doctor will only pay when we get a client, and they had to share 10% of the revenue or something like that.
I see. So
Yeah.
they're not paying they're not paying a monthly fee. They're paying a percentage per
Patient.
patient.
Actually, it's the other way, isn't it? You collect the money and you send the money.
Yeah,
not
whatever
their
it is.
way.
Sure.
So they don't have to convert to
And then
dollars. You are converting it to the
And then
Venezuela.
once that's been established, you're going to start converting some of the money into pills that comes along with the tourists.
We can go into different markets once we.
After the problem solved there,
Like, here's 3 bottles of pills. Where's
you
my
can make
$100 discount?
everything you want in Venezuela. Like it's going to be a
free market for you invest in wherever you want. I have thought about a lot of ideas maybe there. We don't have, for example, just a hospital for women to go there and birth. And
We don't have
we don't have
OB departments.
yeah, we have OP departments, but we don't have just a hospital for that.
You don't
Okay,
have women's hospitals.
A women's hospital, a complete women's hospital. You have one here, so that's a big market there because we don't have one. We also have this. This was a government idea. They built these models, these small hospitals in the popular areas, and right now they are kind of alone. There are not doctors working there. So I have thought that maybe if you can take doctors and maybe control talk with the government and maybe take part of those models, you will have small clinics all around the country.
Yeah, anything to do with the government will take 10 years to just get the signed
Yeah,
contract.
that's right. That's right. But
So by that time,
There might be a new government.
So we don't want to work with the government at all. It's so slow. Yeah, business people are very fast because we don't have money and we have to survive and we need to make money immediately.
So return on investment per unit time is the way.
For me,
Return on investment and return on time. Though that actually introduces us to a slightly different problem that we have here in the U.S., where everything's gotten so expensive that it's almost becoming profitable to do return on investment and return on time on savings instead of bringing in new revenue, which is bizarre. It's because the American market is, well, rather jacked up in my opinion. And I do mean jacked up like with a car jack. That's sort of like the opposite of what Venezuela has. We've got all this stuff, but there's so many middlemen, there's room to cut enormous amounts of cost, and while you do it, increase some of the people's profits by cutting out some of those middlemen. And it's just good luck regulating that. But the need is there, and the return on investment theoretically is sound. I just don't know how to do it.
I know exactly how to do it. And as a matter of fact, I come from India, and everyone in my family owns a pharmacy store back home. And as a matter of fact, when I first started entrepreneurship, I didn't know what to do. The easiest thing I thought was ask my dad to send some pills and sell it here on the black market and make money. That was my idea.
I'm not sure your idea is.
And I asked my dad to send $2,000 of Viagra.
You're not going to be able to sell that.
Then he got so suspicious that it was for me. No, it's not for me. I just quit my job and I'm trying to start a business. I didn't know what to start. So this was the first thing which came to my mind.
You can't sell.
And I asked
no one will buy it here.
No, in the black market you can.
They'll buy a lot.
Yeah.
Too expensive in pharmacy.
You can buy anything on the internet.
Exactly.
Sometimes $65 pill, like they can't afford it.
I basically wanted to sell it on Silk Road. If you guys know what Silk Road is.
I've heard of it. I don't know.
What?
Or was.
Yes, it was.
Fine.
And my dad was so reluctant. I pressured him to send it. And then that $2,000 of drugs got confiscated by custom. And my dad was so angry at me.
You actually went through with that.
Yeah.
Wow.
You told it. This is why I taught you. I paid you money for going to school for this.
He said, don't do anything illegal, but I forced you to do it. And he got so upset at me.
How much is it?
That was not a good move.
Yeah,
Cal.
I learned it.
For like 4 different reasons. That was not a good move.
Yeah.
Now I understand your reaction when I was talking about this Venezuela.
Yeah, they get confiscated. That's the problem.
I remember.
Yeah.
My best friend who was in Pittsburgh, her grandparents are still in Venezuela, and they're diabetic. So they were sending 3 big boxes of, I think it was rice and beans, just consistent food supply, rice and beans. and apparently they may have had to bribe someone, and they had to like pay a little extra on the shipping to have them shipped with an actual watercraft to Venezuela because flying in wasn't reliable enough. And of course, because it's a ship, now it's volume more than mass that matters. So 3 very densely packed, heavy boxes of food went out, and they had to bribe people just to feed their grandparents?
That happened. That's the situation. You're describing it perfectly.
That was my first real personal experience with the situation there, and I was like, what in the actual flaming hoo-ha is going on there?
Yeah.
No, it happened in America not too long ago. 56 years ago for Indian community. There's not many people, there's not many Indian shops, spices and everything else. So people used to import like that. Directly buy, ship it to locally to home, and people will buy it for a month's worth or a couple of months because these are not perishable. They will bring it
Like
about.
saffron or something.
Yeah, they will buy it. They will buy it in bulk and keep it for a while.
Can you start that?
Very common.
Yeah. Hey guys, why don't we go around the so your Andres, whatever business you want to start, I'll be happy to help you. Okay, we can look at getting pills from India, but this time I don't think so. I'll talk to my dad about this.
You're not going to get Viagra.
Yeah.
You don't want Viagra.
Realistically speaking, the main issue with importing anything into Venezuela is the level of inflation related to the currency in Venezuela.
The exchange rate, you mean? The exchange rate is crazy as the currency.
And so any exchange that you do, once the exchange has been completed, the value of the currency depreciates.
Can you start that
Pretty remarkably.
over there?
And so when the Indian government tried to exchange goods in Venezuela, it was for one commodity to another commodity.
Putting stock in the currency.
And so, I mean, like, oil would hold its value, even though I don't know what the currency is called. It's called a peso.
Yeah.
So, like, yeah, the currency would depreciate. So you couldn't trade IT for the Venezuelan currency. So you had to find an alternative method. And so you're forced into like a barter mode. So if you're going to be doing this, you have to, until the political situation has stabilized and the currency has stabilized, you have to find something that you could import.
But his model is different. Is connecting with the plastic surgery.
Yeah.
The money is paid here in US dollars. And for example, we or Kalyan, he pays the money to the doctor. Not the doctor paying money. So the patient is the
10.
And that's probably
It's a dime.
that's
Under a dime per bowl.
probably the official. Okay. So yeah, that's a problem. I mean, that's a problem. I know.
Dime per bowl.
but see that
You're
Indian
welcome
cents
for
per
reading
dollar,
the
6 cents per rupee.
6 cents per dollar sounds like the yuan.
No, yeah, 6 cents. The number doesn't matter. It's the relative variations what matters.
But I mean, like,
With a chart.
Japan, a million, yen or something like 1 yen is $0.01.
It's been going
It doesn't
down.
matter because you're talking about a relative value.
but I mean, so
Just under a quarter back in 13. Dropped to
say 40 years ago, a little over 40 years ago, when I
Okay.
came to the United States,
Mhm.
what was the value of the rupee to the dollar?
Okay.
Right?
Mhm.
Maybe 15 rupees to the dollar.
Right.
Now it's 64.
Right.
30 years ago, it was 30 rupees. So it's lost, The Indian currency has been devalued by 50%. But over a 30-year period, you can that's manageable, right? That 30 years. Look, how much value are you losing over a yearly basis?
It's
I
jumping
mean-
a lot, especially compared to the Bolivar.
So-
It was back in 13 it was up to almost 19 cents on the dollar.
No, see, I think we're getting past that. The currencies fluctuate with each other all the time, and there is hedging and everything else. That's what people do in foreign exchange markets. It's a commodity market. It happens all the time. But our focus is on healthcare. See, what can we do in healthcare in terms of helping each other out, and what kind of problems we can solve.
But and I agree, it's the problem solution in this case is send pills there.
I'm not. I'm just-
There's a bunch of ideas. One is
But
we
it's
can.
a not for profit thing where we I don't know, buy a few crates of these pills, aim well to make sure they get to where they need to go, or maybe package them all into a lot of little crates, paint it and prep it all here out of donations, and then have some military contractor just carpet the area with them so that they're distributed now.
So airdrop them. The police will just pick them up.
But not all of them.
The majority of them.
I like the one.
Not the best part.
I like the model. Instead of the missiles going there, you have a big cartridge of Viagra going there. Everywhere. So what are you going to do with that?
Yep. So let's move on to some of the problems at home,
Yeah.
which we can fix.
Think so? Kalyan is optimistic.
So I want to give opportunity for other people to chat, because if anyone has any ideas they want to talk about, the floor is yours first. Anybody? Okay. So these are some of the startups we're working on, and I'll go one by one, and then we can discuss and see if something excites you. So this is based. We are trying to address opioid addiction here. Opioid addiction is an epidemic in America. This is a first world problem. We don't have food to eat here. People are dying because they're having too much fun here. They're getting high.
No, they're looking to be happy without knowing how to get there. They're trying to take too direct a route,
Yeah.
and the side effects are basically death.
Yeah. Exactly.
So, if you want to apply the Venezuela model, instead of throwing the pills there, we have to throw beds into America
Not
because
can.
we're not getting enough beds.
Yeah, I don't think that's quite going to work.
So the problem statement here is that the demand for people who want to get detox, the addicts who want to get detox, is much higher than the supply of beds, because it's an epidemic.
That's interesting.
Yeah, it's an epidemic right now.
But I didn't know that the epidemic was mostly
People want to
comprised
get
of people
treatment?
who
Like, the problem
wanted
is
to
people
get
want to get treatment. There's not enough beds.
Yes.
That's not enough beds.
I knew there were a lot of
Surprised to hear
people who are hooked. I
Oh,
didn't
yeah.
realize that there were so many who wanted to get unhooked.
Yeah,
Yes,
exactly.
that is.
It's coming from their loved ones, okay? They've had it living with these addicts, and they want loved ones are
Now,
saying,
hang on.
okay.
Is this the addicts wanting to get unhooked, or is this the loved ones of the addicts
Okay.
wanting them to get unhooked? 'Cause
Take
that's a huge difference.
No. Think of the use case. You have your family, a member is addicted.
Yes,
You want that person to be detoxed.
yes,
You are not going to be able to do it at home because it needs a special regimen of activity.
Yeah.
So you want them to put in some place so that they will be treated properly and come out of the detox. But there is no bed.
Yeah.
You call, everybody's booked.
Question, because I don't feel like it's been answered yet. That, I agree, is a need looking for a supplier.
Mhm.
But, and this is totally a patient compliance question, and it's a big one. Are the people who will be going through the detox, do they want to go through the detox?
They do.
Okay, so the people who are doing the shopping around are the loved ones, but it's
No.
The
The two,
spokesperson who
the two or
wants
three
to-
groups.
Yeah.
One is the loved ones.
Yeah.
Okay. Another one is the state. The state
doctors
identifies
themselves.
somebody,
the doctors.
and they have doctor says this person should be detoxed.
Yeah.
And now the hospital is trying to find, or the caregiver, whoever the care coordinator is trying to find a bed.
Yeah.
They don't know. They don't have any place.
Yeah.
Because it's not just a bed; it is everything surrounding it. Okay. It's not just in a bed in your bedroom. These treatment centers are very unique.
Yeah.
There's no sharp objects. There is no nothing. I mean, it's got to be really, really controlled environment.
Yeah, it's controlled environment, totally
It's a
controlled.
mental health issue.
And we're talking, so how about this center setup? Who is managing it?
There are,
This,
it's a big business.
yeah, it's a huge business,
It's a huge
actually. We
business.
came to know this. And it's both state public run and private run as well. And they're giving a lot of private licenses because right now there's no beds.
Really?
Yeah. And what's that?
The people in the beds are willing? That's the piece I still don't feel like I
The
have
people in the beds are what? Willing what? To get detox?
Yeah. They're on board with all this?
Yes.
Okay. That's like.
They're put in a control room. They cannot leave.
But are they there because they want to be there?
Doesn't matter if the state says you're going to be confined to a detox center to be detoxed. You're not going to get access to the medication. That's it. You don't have a choice.
I think you're asking is a legal question, meaning if I'm a grown-up, nobody can treat me against my will. That's what you're saying. Meaning somebody not like I'm can afford somebody a grown-up to go for it.
You can try, but
Legally, you can't. Basically, you control them.
so we're talking just about minors now?
Any human.
What the state or doctor says, this guy
Needs to
need to go into detox mandatory. Fortunately, whatever you.
All right.
Yeah. You want to get out of that.
Okay.
Nothing can stop them. That person can go out.
We're just addressing this grant, Ben. There's an open grant from SAMHSA. SAMHSA is the federal agency which is responsible for substance abuse and mental health. So they have put up this grant and we're trying to address that.
I'm not gonna read this very fast.
You can take your time. Basically, they're saying is that, yeah, there should be an easy way to have people find beds when they need treatment.
And you'd like to be that supply.
Yeah. I'm sure many people are trying to solve that. We're also trying to solve that.
That's why there's a grant out there.
The simple,
This
the
isn't
thing
to
is this,
host
the funny thing about
This
this
is just to
problem,
create a program that connects the open beds to the patients.
Yes.
Okay.
Oh.
No, we don't have the capacity to create more beds. That's state or someone else has to do it.
Yeah.
We'll just write a
find
program where we'll
find
centralize everything and it's like Airbnb. Anyone wants to check in, they can
so it
find out.
looks very simple, right?
How do you?
But there is a
the
lot more
transport
complexity. When
costs?
you open up, it looks
So we're not
impossible.
responsible for that.
Yeah.
Yeah.
Okay.
That's its own business. If you can streamline cheap transport for people to get from one place to another and give them reason to travel, then suddenly you can get people who need jobs, places with jobs. But that's.
Many people are trying to solve that. We don't want to go there. Uber and big players are there. We don't want to go there. In the logistics and transportation business.
Too big a pond.
Yeah, that's a big one.
It's a big pond that's a long way off.
So yeah, this is the one we are trying to address, and pretty much, and this is how we are trying to address it. We have two solutions. One is an IoT solution, and and I'll walk you through that. So basically, we want to use Internet of Things technology. Mission statement, and here is the problem statement. Can I move on? And this is the solution we are trying to provide.
Huh. Basically a button you put on the bed that says, here it is.
Looks simple, right?
Yeah.
So that's an Amazon button.
Fine now,
You
but
know the problem? When we talked to the person, they said, you cannot use this thing. Because if you put that in the bed or anywhere,
That's Martin, we don't know.
right, they go and keep pushing it.
the patient.
Patient.
The person undergoing.
They will be curious. They
What
will
about on
pull
the
it, they'll
door?
push it, they will
Other side
do
of the door, right?
Huh?
So like put it on the outside of the door.
But you don't know which bed is. Everyone
No.
can have 4 beds.
And I
I'm
mean,
assuming each room has one bed. No?
No.
They
yeah,
share beds.
can you hold on? Because, yeah, once,
I put them on the bed.
I want just,
Okay,
Yes.
let's continue.
hold on guys. I just want to show you the next slide and then we can talk about this. We can also put this at the checkout place where people can check out. So there's a bunch of places where we can put to
At the
avoid.
nurse station at the
Yeah,
checkout.
yeah,
Don't give it access anywhere near the patients. Keep it like in the room next to the medical records or something.
sure.
And
So
they keep moving the patients around because each bed is for male, female. There are different types of bed, but they keep moving around. Sometimes, oh, it's a bed free. Use it. So the front desk may not know that any bed is available or not.
Oh, that's gonna be a hairy.
We don't want to give nurses more work.
Right.
Do we have some sort of child
Have the
proof
nurses
law?
do it.
yeah.
Just how about like one of those RF readers like you see the security guards using on their rounds?
And where is RFID going to be stuck on the bed?
Hmm?
How is it going to be affixed to the bed?
It doesn't.
RFID, the RFID has to have a little sensor that keeps on beeping, saying I am so.
No.
Sensors
You have it backwards.
above the bed.
You have it backwards. What I mean is,
Heat sensors above the
rather
bed.
than the cleaning
So,
crew has like a
If there's
stick.
no heat being generated
How
in
do
the
I say
bed,
this?
then the bed's open.
Yeah, that sounds good.
It'd be
The basic
expensive to
concept-
implement, but
And I'm not sure what
Possible
technology to
solution.
best
Yeah,
use for
That
this.
sounds good. That
Did you
sounds good.
have
Yeah, I'll take that.
A
notes.
number
Okay.
on the bed.
sure.
It could be a barcode. It could be one of those
What?
square codes. It can be whatever.
Whatever you stick in, they're going to peel it.
They'll print it onto the bed with a little handheld printer.
So you have to go to every bed and have to print it. They will erase it, wipe it. They put something peanut butter on it.
Peanut butter is not a problem in this country. You're talking
If
about
not
the
peanut
same
butter,
people.
something else. I don't think-
These are good ones. We just had to. We haven't really gone to the client and talked to them primarily. We just sitting here in the room and
No,
The thing is, if you have a
No.
scanner of some sort,
I'm-
all you need
See,
is a barcode on
the
the
person
bed.
whom we talked to,
Martin.
he's in the business. Okay,
He's
when he
only
raised-
one data point.
Agreed, but the point is one data point. Let's see if we have a solution for it. And the reason I'm asking is not to put barrier as a being flippant. This is when I started with, oh, it's very easy. I can put a barcode sticker. That's how I started with.
You need to compare.
Okay,
it to
but
the,
when I saw the response from a person who is actually in there faced this kind of thing in real life, and he raised the objection, then only thought, oh, maybe it isn't as simple as that. So maybe you have an answer for that. That's why I'm trying to provoke you to the point saying, maybe you have an answer which I cannot answer. That way,
What if we
wow,
hide
you
it?
can go for it. Huh?
What if we hide
Oh,
it
I
like?
hope so.
No. I want to hide
They're
it
gonna be
under the
very
foot of the
bored.
bed. So you have to lift the bed's foot to take the picture of it, and then you have like a little booty.
You think people will do that if you make it that hard? Why don't-
maybe not.
Why do you think we have see, have you seen the child-proof locks? Caps?
So here,
The child will open it in 2 minutes. I'll be the one struggling.
So here's the deal. Any solution that we make,
It's not going to be 100%.
well, no solution is going to be 100%.
Yeah.
There's always going to be issues. But two, I mean, we always need to make it simple, right? And so I know a guy that does IoT things.
Yeah, please connect me to him.
And I've been meaning to email you. I've just been so stuck on legal issues and interviewing with other companies that I just haven't been able to get information over to you. I'll get the information over to you tonight.
Sure.
Let's set up a meeting. Let's see what type of device that they can design. Maybe we can put like a little passcode on the devices. So even if someone pushes them 1,000 times, it doesn't do anything until the person that's authorized to make those changes makes those changes.
Agreed. But the problem is, if you have the device fixed, they will just pull the physically device off.
So
That's the end of story after that.
So
So you have to think really weird, saying that how do I make it so foolproof that no physical
Nothing
thing
is
can be.
foolproof. Fools are too ingenious.
I mean, that's what I'm trying to find. I agree. I mean, every solution, everybody attempting is very, very bad. So, I mean, I respectfully accept all that, but
I mean, what about all the other medical devices that are in the facility? I mean, do the
they
addicts
don't.
touch-
These rooms are very much sanitized to the point. No sharp objects, no switches, no nothing. Everything is controlled.
So let me talk to this person, see what type of devices they can create, because he owns a company or works with a company where they design these types of devices, and then makes Internet of Things security devices as well. So if they're making security devices, they have to be able to design devices that are somewhat foolproof or can prevent someone from, altering them. So maybe we can't put them in the room with these individuals. Maybe they have to go inside a different room or something of that nature.
Whatever, when we propose a solution to this solicitation, our idea, whatever we present, better be thought through correctly. That it has a good chance of working. That's what we have to do. We cannot simply have ourselves say, I have the idea of this and do that. That won't work because we have to understand the real scope of the problem. And initially I thought, oh, it's very simple. We know how to do it. In fact, we have a solution. We can just apply. Not so. The nuances of this are so weird that I found that we need to think through. It's not that easy. If it's easy, many people, they wouldn't even have a solicitation. They would have done it by now. There's a reason why they're not able to do that. And the first thing is getting on a computer, on a website, connecting it is easy. The sensing availability accurately so that you get that information in real time or near real time, that is hard.
Why can't we create a mobile app?
You can do anything you want.
Yeah.
How do you get that information that the bed is empty or not accurately to that system, to that app is where the challenge is. Once it's coming out, we know how many 100 ways to do it. We can do mobile, we can do any number of things, we can do it, But that point of the last mile as it is, that identifying a bed is available and then I reserve, and when I come there, the bed better be available. If I got it and I reserved it, I went there, the bed was reassigned to somebody, we haven't solved any problem.
I'm want to go back in the same room. Is it possible? And what do you mean if the bed is empty? If a patient is not on the bed, or what do you mean?
Suppose he walked out for the walk or something like that, or restroom, it's going to start triggering. We thought that we'll embed it in the bed, so if the person is sitting or lying on it, we can probably give saying if nobody's sitting there for half an hour or 1 hour, maybe it can detect as being empty, but the limitations of that is somebody not there. And most importantly, the bed, say suppose it's detected as being empty and you reserve, by the time the person reserves and goes there,
No, there's no reservation. We'll just say it's available and people have to call. This is not a reservation system. That's hard to do.
Okay.
So something like in the car, when we sit in the car and we don't look a lot, so it's out.
Yeah, so we thought about different ways of addressing this problem. One is using pressure sensors. So you can have pressure mats below the bed.
Oh, that's what I mean.
Yeah,
Okay.
yeah. If someone is sitting on that, then we know that someone is sitting on it. But again, these pressure sensors have to be connected to an electric outlet, or there's some batteries need to be changed. So there's a lot of work. That's one thought. Then another solution we thought about is, hey, every room has a camera in it. Why don't we use computer vision to find out if people are there on the bed or not. That's another one. And this gentleman gave me another idea is why don't we use heat sensors, which we can say if we detect heat on a bed, then we say someone is there. If there's no heat, then nobody's there. So these are some of the things we thought about. And we thought this one was the easiest solution we thought.
What if there are 4 beds, 3 people, and they go around walking and sitting in any bed? So
Well, so does that actually happen? Because they share rooms. The beds share rooms.
Yeah. They socialize.
But why would they? They might have social activities.
Yeah.
For sure. But
Yeah.
I mean,
they're not
it
single
wouldn't make
rooms.
sense to put.
They're not single rooms. I
No.
mean, it's too expensive.
They are shared.
That's too expensive. I mean,
Yeah.
these are people who are not really having that much money. The
Yeah.
state is putting that because they don't know where else to put it.
The question
Yeah,
I
if
have,
they're going through
okay,
withdrawals, I can't imagine they're like.
when a person goes to the clinic, are they there for hours or days? Or could
Weeks.
be- or could
Weeks.
be weeks?
Weeks.
Because, if you have to register for a day or week or weeks, you have to go through some sort of a process.
Yes.
You're just not going to walk in. You're
Yeah.
going to call the registration desk
Right.
to verify if the bed is available.
Right.
So that means if the bed is empty, that means somebody has to leave the room.
Yeah.
That means house cleaning has to remake the bed.
Yeah.
Could be easy to have a switch on and off, something that just alert the front office or somewhere.
Yeah.
To say, this room is empty, the bed is made.
Right.
So that when somebody calls, they will call the front office saying, we have information that you have a bed available.
Yeah.
Is it still available?
Yeah.
To address saying,
Yeah.
and somebody not just going to show up there.
Yeah.
So you have a check and balance there.
Yeah. That's what we have
So
right now.
what happens is you have a system that is automated in some way because your website, you are going to look at which is available, etc. But along with that is a manual step where some human being identifies the bed is empty and goes to the front desk and informs. Phone, walking, whatever. That is the slowest step, right? That is error prone. So whatever system you're supposed for providing is going to have that kind of a limitations. What if they didn't come and tell you? What if that information was
What if
not
housekeeping
trusted?
has something right outside the door?
I mean,
Right.
you do many, many things,
They
but
don't
it is
walk,
not,
it's just-
but it's all, when there's a human intervention involved, it is
And you
uncertain.
want to
No.
cut that
Yeah,
out?
that is the only thing. Right now, they have nothing. So if that is the only thing that's going to work, that's the only thing we can propose. I'm not saying that's the only way, but we're trying to find a foolproof, automated system.
That camera you talked about, basically.
Yeah.
Something that when the one
Computer vision,
alert
yeah.
is verified by the digital camera, the room is now empty and bed is made.
You're going to have a right. No, as soon as you put a camera, you're talking about privacy, legal stuff immediately. But I don't shut down ideas,
No,
but I'm saying that
are they not being? Are they on camera or are they
I think
not?
they are.
They are,
Okay,
yeah.
They are.
Yeah.
There will be
Yeah, so if
security
there's a
cameras
camera,
altogether.
then we could use
You
that.
don't have to put anything.
The only thing is that if you want access to all of this, it's a big process to get access to video feeds
Okay.
and all this.
So
We don't want to. We want to circumvent all that legal process. It takes years. By that time, opiate addiction will not be there. By the time we implement the solution,
Then the question always becomes, how many safeguards do you want to build in?
so
It's not a perfect mouse.
Yeah.
so I'm sorry, your name was Vivian?
we're in.
Yeah, Viren.
Viren, VIREN.
Okay. So Viren, I just want to make 2 points. The first point is think of alcohol addiction, right? Look at how addictive alcohol is and how long it takes people to recover from alcohol addiction, especially if they have a very severe addiction to alcohol, right? So you have people that go into detox centers and then rehab centers, and they may be in there for weeks or months at a time. It's usually not, it's not years, but it can be up to, a couple of months, 2 to 3 months. Most cases, they're usually in and out within a month. And opiate addiction is a much stronger addiction. It's much worse because with opiates, you're literally numbing the brain from feeling pain. And when people take opiates, they feel like Superman. It gives them such a powerful feeling that they feel like they're invincible, which is why opiates are so addictive. It is so much more addictive than alcohol. And so if we have a problem where people need to go into a rehabilitation center for a month because they're addicted to alcohol, think of how bad the opiate addiction is because of the effects that it has on the brain. And alcohol is something that, has negative effects on the human body, right? Opiate doesn't have negative effects on the body like alcohol does, right? Yes, it destroys, your organs if you overdose or you take too much of it. But it's different from alcohol. It's not like an intoxicant where you're inebriated. You can still function.
So
with
the
opiates.
thing is, you're saying that it takes much longer to recover. How does it imply? How does it connect to the bed finder issue?
So we were talking about how long people were going to be in this rehab facilities. So you have to game plan for the fact that people are going to be in these facilities for an extended period of time. They're not going to be in and out in 1 day or 2 days.
Totally, it's a process.
It is a complete process.
Yeah.
And so let's say, a person's going to be in there for a week, minimum. And so the way we should do it is, what's the time? Take the bottom 25%. How long are they in there? How long is the top 25% in there? And what's the middle 50%? So we have 3 barometers for how we're measuring the length of stay.
Okay.
Okay.
Suppose we pick 1 week, 6 weeks, 4 weeks.
Okay.
Bottom 25 is 1 week. After 1 week, they leave for somewhere else.
And then we can design our system to, for the people that manage these facilities, to work with a system that's based on someone staying 2 weeks. Obviously, if someone's in and out of 2 or 3 days, that's a management issue. That's an administrative issue that the facilities would have to take care of. But we're not talking about someone going in there every single day saying, okay, Let me count the number of beds. Let me count the number of people. But that's the first question. That's my first response to your question about, how long are people staying in these facilities? So let's compare it to another process. How do we treat alcohol addiction? People are going to rehab facilities for weeks at a time, 2 to 3 weeks on average, bare minimum. The second thing
there is a difference.
Yeah.
The alcohol addiction and detoxing alcohol, the facilities are not that stringently designed. Okay, it's a milder, relatively speaking. So they're there. They don't get access to alcohol, but they're not self-hurting kind of model.
Yeah.
Whereas in the case of here, they are physically dangerous kind
You
of
want to present?
themselves and the thing. So because of the facilities are much more tightly controlled. That's what I hear. Okay,
Yes.
I could be wrong. Maybe there are gradations of it. Some facilities may be more open. Some people may be.
And the second
We don't
thing that I want to discuss is what we're doing is going to involve a lot of different state agencies, right? They're all going to have to get together. And that's why I wanted to bring Amit into discussion, because he knows everyone. He's like next to Cal. I don't know anyone else who's more well connected in terms of politics and people that are in government that can work and push and get things done. Amit told me, he goes, the reason I'm powerful, even though I'm poor, is because I know so many people I can invite to all the A-list parties. And if anyone wants anything, they need to do me favors if they want to get invited to the next A-list party, right? He knows people like Narendra Modi. He knows politicians like, Governor Patrick Duvall, or people in the governor's office or the mayor's office, or all the city council members, because he works with a lot of nonprofits. He's on I think at one point he's on 8 different nonprofit boards, right? And so the reason I want to bring him involved is because he knows all these state agencies, the local governments, the city governments, the individual agencies, and all the different hospitals, and can bring them together, because if we're going to be doing something, it has to be under a single policy, like a state policy.
Yeah.
And we can implement a policy to where everyone has to follow this procedure.
Yeah, let me. I'm sorry to interrupt you, but I'm working with the commissioner for the state of Massachusetts for public health.
Okay.
We cannot go higher than that,
Okay.
because she's the one responsible for the public health of the state of Massachusetts. And we're working with them, and we propose these solutions, and they're talking to the people, and they might get back to us
Okay.
with feedback. So hopefully by that time we'll have a couple of solutions to test it out at that time.
Okay.
So we are talking to people at the highest level who have the decision making capacity to address these issues
But let's say
on a state level.
if we develop a solution, we can say, okay, if this solution is going to work effectively, it has to be done on a statewide level.
Absolutely.
Every single facility has to adhere to this policy if they're going to receive money from the state.
Yes.
So we can force people to say, okay, if you want to see patients and generate revenue from patients coming into your facility, we're going to make you adhere to this policy.
Yes.
And so
that they can do.
And so one of the benefits of this policy is we don't have to be super cheap in the program that we administer. If we create a policy where we're using, laptops or iPads or not just an iPad, but maybe a notepad or whatever you call it, where a nurse or administrator goes around and updates information. Those iPads or notepads aren't expensive. They're not cheap, but okay, we can, there's a cost to that, and we can say, okay, you're going to spend the money. So we don't have to have the cheapest solution just because we're a nonprofit and we don't have a lot of funding. Because if we're working with state agencies, we want to develop the most effective policy, because we want the effect. Whether or not a state government is going to adopt our policy, or our advice is whether or not how effective our policy is.
At this point, none of the solutions are being excluded because of cost.
Yeah.
Feasibility is the problem.
Yeah.
But I wanted to bring that point up simply because I want to expand our thinking and not like this guy was right here, and he was just making some comments just to be funny. But when I'm coming here not to be funny, not to crack jokes. I purposely do not crack jokes because I want people to think seriously and come up with real solutions.
I hear you, man. Thank you.
And so I wanted to bring that up so everyone understands.
Yeah.
Don't limit any solution that you could think of,
Total. That's exactly right.
especially on this particular issue.
Yeah.
So let me ask you,
I have to
go to.
Go ahead.
Go ahead. Go ahead. You're right.
What is the current system right now? Assuming we have a center, we have hospitals or clinics or whatever. How do they monitor right now vacancy or whatever?
Call all these places and say, do you have a bed available? Do you have a bed available? That's the system.
The
Right?
question is, those centers, how do they keep track of if the beds are available or not? What I'm saying is
They don't.
observing some common behavior patterns.
Exactly.
You
You're
may
right
be
about
able to optimize the application.
You're
And
absolutely.
the mechanism becomes a secondary.
Yes, you're absolutely right.
That is very good. Currently, they have
The
that
thing
some
that- the thing-
manual method.
Currently, if you have 50-bed facility, you may have 3 or 4 beds available, but you don't know. So if somebody calls and say no bed available, even though there may be, so occasionally you have to be really aware of it to say yes, we are available. So if 10 is free, oh, we have bed available. If it's 2 or 3, they may not know. All random. At this point, it is just may happen, may not happen.
Another solution is that we can have a barcode on the bed and the barcode on the patient. So we scan we just stick the barcode or whatever invisible ink, and we scan the barcode on the bed and the barcode on the patients. So whenever the patient leaves the hospital or the clinic, we scan it again. So or change the bed, we also scan the barcode again. So we know if the patient is or not. So we also know that the bed is available.
That's a good one.
That's simple.
But that's a good one. But why do you want to put 2 barcodes? Just one barcode to the bed is good enough, right? Invisible barcode.
And then on the patient too.
Why?
So to know when
We're not tracking the patient. We're tracking the bed.
So but we have
Maybe
first of all,
confirm that the bed is
sometimes the patient
patient's
went to
leaving.
the bathroom or goes to make a phone call. So
No.
we still know that the patient's in.
No, patients are not just walking out of the facility. They'll have a discharge procedure.
Yeah.
So if the patient is literally being discharged, you know that patient.
Yeah.
As opposed to they went to the washroom.
Yeah. They can discharge people just like that.
I say, okay, bye, thanks, good. You have to have all the paperwork. You cannot, at least you have to keep track of what happened. If they went out, at least you should know that they went out. You cannot stop them perhaps, but you can keep a record of it. And you have to. So you don't need to track the patient as much as the availability of beds. When a bed is empty, we want to know that so that our system should tell others it's available. And the more automated, the better. But given what's happening, I don't think automation is going to work here. There need to be some manual intervention, and the system will have some failure points because of this.
So what you're saying is the patient has to be discharged.
Mhm.
When he's discharged,
Mhm.
somebody has to do some paperwork,
Yeah.
electronic or manual.
Correct.
Yes.
If they do electronic, you already have them somehow linked to the IT system in a way that automatically triggers.
Yes.
The patient has checked out,
Yes.
meaning the bed is available.
Right. Is there? That is the right way to do it. But connecting all these disparate systems will take us a long time because
See,
we need to get
there's one way.
permission from each and every.
See, the one way we can do. There's one way, Kalyan.
My knowledge.
Kalyan,
No,
he brings an excellent point. There's
Yeah.
one way we can do.
Yeah.
Suppose take a facility.
Yeah.
There is 20 beds.
Yeah.
And you have to take an inventory at a particular instant of time. There are 20 beds, there are 18 people.
Mhm.
From there, you can back calculate. Whenever a new person is admitted, decrease the count. When a person goes out, increase the count. The difference will be your number of beds. So you don't know which bed is available. You cannot track that on a bed level, but you can track on a facility level.
Available.
This facility has 20 beds, 15 people right now. A new person comes in now, 16 people, so only the 4 beds are available. Leaves, then you have 5 beds available. You can keep count, and count can be kept. And for that, all they have to do is the nurse has to tell us when the admission and discharge happens.
That's exactly what we can do. That's my next
We
point.
don't need a barcode on the bed or anything because we can't differentiate. The nurse says periodically you can do any matching and fix it if there is too much of a mess. If 20 beds and 25 people came in, you know that the company stops, so go back to the computer and set it up.
Yeah. So this is the solution. The one you guys are talking about is patient notification solution. Okay, anytime a patient gets admitted, transferred, or discharged, but the thing is that not each and every facility has an electronic. They're not they're not hospital, they're not mandated to have an electronic medical system. So this, even if they do, then we don't know this 1100 certified electronic health record systems. It's also
Don't go to electronic medical records. Just go okay. It's a simple website. How many beds you have in the facility, which is already fixed. Go to the facility, go to facility number 1. We already know that. So you show 20 beds. How many currently you have in patients? 15. Okay, thank you very much. That's all I need. Then every time when you go there, go to admit 1 or discharge 1. End of story. No, 2 buttons. It will increase the count or decrease the count. All we need to know in the outside other system is to say this facility has this many beds available. That's all we need. And they will know that it's available or not. So every time a patient admits or not, the nurse doesn't say I have 2 beds available. They simply say I discharged 1 person or I admitted 1 person. It could just even be a little pad on their side. If it's a red button or a green button, whenever you admit 1, you press a red button. When it's there, and it says how many beds are available, number there. I mean, the empty beds available, and that gets distributed to the main system.
So
Simple. But it's in the nurse station. We don't do the bed, we don't do barcode, we don't do any such thing with the room.
So it's a simple website.
Simple website and a little device maybe.
But
Red
you're
button.
asking whoever's at the front desk to do an additional step
Yeah.
Press a button.
and do something that
Yeah.
you're adding one more thing to their
Yeah, I
routine
know,
of the day,
I know.
and you're relying on them to do it properly.
Yes.
Yeah.
And that's something that I don't think you can do.
Yeah.
Because why do they want to do that?
Because that's
Does it make their company more
no,
money?
No. Because the state is paying money, they can force this. State can say thou shalt do it. But there is a human intervention, there's a possibility of error. So you can say red, green, and clear. Whenever you want to say reset button and re-enter the new data. Okay, you can do it. Maybe a numeric keypad that's given there. And it's got an IoT wireless, connects to the whole world internet-wise. It doesn't have to even be connected to the computer, website, nothing. It's just a little button. Whenever you press, clear it and give a number, whatever it is, right? This could be a simple counter. And you can say every facility has to buy, keep it, and use it.
So, I mean, one thing I'm not really big on is the actual dash buttons, and here's why. Is because a person's going to be in a facility for an extended period of time. So it's not something that you need to update on a daily basis. If, for example, like you need to have high availability or immediate availability, and there was a very high level of turnover, right? Like someone was going in and out of the facility and they were in that facility for 4 hours.
No.
As soon as that slot opens up, I want to be able to use it again, right?
No, not like that. The residence time, the number of days a person stays in the facility, maybe 2, 3, 4 weeks, doesn't matter. Not everybody come at the same time and go at the same time. So at any given day, maybe 2 people, 3 people may come in, and any given day, 2 or 3 people may go out, but the person may stay for 2, 3 weeks.
So
Okay, just because somebody is staying a long time doesn't mean that you don't operate. You may still operate, periodically. You can find out the track record, how many people come.
You want to present yours?
Yeah, I can you can go to the.
You go ahead. I got to step out. I'll be back. But you can use my computer.
I was going to say, at the end of the day, it still comes down to
Sure.
an administrative issue
Yeah.
of as soon as someone is discharged or admitted, then the facility has to update a central system.
Fully automated. Yeah.
I just gotta check in someone else.
Or many different facilities will be using. I mean, there has to be one single database that many providers and individuals are using. So,
I don't know, because this is all ideas that come in through the discussion. We can propose to the right people and say, okay, what if we did this? Will this work? Let them shoot down the idea. If they shot it down, then they shot it down. If not, it might survive and may come up with an answer that we can propose. We really don't know. But I think that there is an administrative overhead that has to be included in that, because you cannot do automated.
I think one thing that you can do is like use invisible barcodes, so that it does become available. You can scan that particular bed. This is the bed that's available, and
Could be. I would love to see that, but I thought that could be that simple.
Get some solutions.
When I talked to the people, it was not.
So I know some of
So
the
we
science
probably
label buttons.
wait.
Oh yeah, there's
Yeah.
yeah. I'm
I mean,
talking
they're
about
possible,
weights,
but
but
then you have to
like
go through the
weight
whole
is not able
system
to
already
like
to
count
change.
multiple trucks at the same time.
If they already
Well,
have
I'm
beds
thinking
and
about it
everything
too.
else,
Maybe
and you have to
it
go
will
and
be on the
say, change
system.
all this.
Yeah,
to
it,
the
will,
number
it
of
might
beds.
be on the
That's not
system.
that's not administrative nightmare.
Yeah, when
You're
it's
putting a
image
barcode
capture,
stick on this
What's that?
or
is
image
hard
capture.
enough for every
Like you take a
bed,
picture of
and then
like,
scanning it
the
and getting
pills,
the status.
pills on the tray.
Now, if you
And
want to
able
do
to tell
anything
you
more
how many pills
But
you
you
have.
don't have to
Oh,
stand.
Oh yeah, yeah. I mean, yeah, that's one
Just
of my
like this.
solutions.
Whatever.
Oh,
If
Yeah.
now
But
putting
that
something
also
hidden or
exists,
something like
Oh,
that,
But what I'm,
you have to go and
yeah, I'm gonna
manipulate
tell,
every
yeah, what I'm
place and
trying to do
every
right
all
now
the
is just like
hospitals. These are all not
um,
very well
go
done
into the,
facilities. These are
the
cheap
middle of the
facilities.
market where I
They
can
don't have
build
the
like
manpower to. It's
like
not like
more
a
efficient
we're
or
thinking like
like
a
the
posh
same like
facility.
level of
These
efficiency,
are down
but
and out
much more
guys, and they
affordable
are being
for
there to
like
treat.
independent
They get a
pharmacists.
few dollars here. They're
So they
old,
do
dilapidated
different
buildings,
drugs
and
at
more
once.
people are coming in.
Yeah,
Just
multiple
whatever
drugs
they
at the
can
same
do.
time.
Oh, so just like dump your entire stock.
Oh, no, we don't use salt. We
I don't know.
It's
We
a
don't
barrel.
have that.
It's a cage.
Okay, good.
They're separately. Yeah, I will
That's
tell
yours.
everybody. Yeah.
Yours. Go ahead.
So yeah, like I mentioned earlier, like my team and I are trying to build a smart pill counter. So the reason why I have I had this idea is because like currently on the market there is like inefficient, cheap, not very cheap, inefficient like pill counter, which costs around like $5,000 to $10,000. But like it's not completely automated. It's like semi-automated. Like humans still involved in it, and you kind of like manually pour the pill into the machine, and it counts automatically. And there's another existing product which is like a giant robot, a pill dispenser. It does everything for you. Like it counts the pills, dispense the pill into the vials, and close the caps, slug the label into the vial, and then we just go there and pick up the vial. But it's too expensive. It costs probably 100,000 to $500,000. So like with that being said, like independent pharmacists are not able to like buy that giant robot or like inefficient like pill counter. So I'm jumping to the middle. So which I will like build maybe the same level of efficiency, but much more affordable for like independent pharmacists. So here I came up with 4 solutions. The first solution is based on the current solution pill counters stack up multiple units, of pill counters, and a technician just come there and pour the pill into each hole, and they be counted automatically and dispense into each vial, like that, and we just come and grab and put the label on it. Another solution is intelligent cap or smart cap, whatever you want to call it. So let's say when we purchase a new bottle from wholesaler, we like, I'm not sure if you're familiar with
Totally not.
totally not. So this is how we dispense pill in pharmacy. So we purchase like a big bottle, 1,000 pill bottles, and we like, let's say if you want 30 pills, your doctor prescribe you 30 pills of amlodipine, which is hypertensive medication. So I would dump it to the tray, this one, and I count manually, like that 5 by 5 until like 30s from a 1,000 pill bottle.
So is that the standard right now?
Yes, manually,
Manual
like,
standard,
manual,
that's the standard?
standard
Okay.
right now. We count it like that, manually. So so the 1,000 pill bottle. When I first purchased, I open it, and I replace the cap, that original cap, with the intelligent cap. So this intelligent cap itself is a dispenser. It's a dispenser. It has some like it's we can like, enter any number of the pills. They are originally from the bottle, like let's say 1,000. Just put that 1,000. So this is the label. We print out the label. This is the label. So like a technician be able to see how many pills needs to be dispensed. So let's say 30. So this intelligent cap just scan the label, and then it only lasts like 30 pills dispensed out of the bottle, and I can keep track of the inventory too, and it's linked to the POS system. And that's in our solution. This is the more optimistic solution that we are doing market research right now, which is a vacuum pill counter. So we use a vacuum compression to suck the pills from each bottle, into vials to dispense to the patient. So that, by using like air compressor, that's it. Yeah, we just have the label, we scan it, and then whatever drug say on the label is, it decide like drug A, B, C, or D, or E will be will be sucked into the vial.
Yeah.
So that's what I'm doing. And the last solution, which is Google Glasses. By using the image capture solution mechanism. So this glasses can take a picture of the pills on the tray, and then within seconds, it will tell you like how many pills there are on the tray. That's it. That's for solution I have so far, and I've talked to 90 pharmacists and pharmacy students who are currently working in pharmacy. And I found out that the vacuum pill counter seem most optimistic, but they are not the decision maker who will make the decision to purchase my machine in the future. So this is the challenging part right now. I'm reaching out to pharmacy owners, independent pharmacists, to ask for their opinion, collect all the data, later, to add more value proposition to see what they are really looking for. And also I will use the data to present to investor to get fund. So that's my that's the stage that I am in right now. And as a student, I don't have a lot of credibility, initially. So I'm struggling how do I approach to pharmacy owners to to get their attention, so they want to talk to me as a student. Because there are many excellent companies are building pill counters and as well as dispensers.
So looking at it, since there are so many pharmacies, right? From CVS, meaning chain, pharmacy chain, CVS or Walgreens of the world. And then you have mom and pop pharmacy, private owner.
Right.
And then you have a giant like the Walmart and the Costco of the world. Where do you see the need for an automation? Because it has to go with the volume.
Right. So you're right. I see every high volume, medium to high volume pharmacy has the needs, based on my perspective. But why I'm initially targeting independent pharmacy or private owned pharmacies, because it would be easier because I can use those people to prove that my machine the concept it really work, there's customer need is valid. And also I don't want to really target CVS, because there are almost 10,000 stores over there. And what if at the beginning I target them and they say no? So eventually so I will lose a lot of sales later.
Or you could possibly get them on board, and then you've got 10,000 stores that are.
But they're not the early adopters.
They're not early adopters. They will see a lot let's say 20 independent pharmacists save a lot of money, because based on the calculation I've done and some experiments, so the machine, the vacuum pill counter, will save 27,000 a year in the profit, net income. So which about save from 15% to 22% of the whole income for pharmacy owner, each pharmacy. So that's a lot. But compared to CVS, their revenue is the sale is a bit. So I calculated it's probably 1%.
If it's one or two or a few mom and pop and independents, they can change the workflow very quickly. Whereas if it is CVS, they have to change their workflow in hundreds of facilities simultaneously. That's a chore in itself. We had a person from CVS participate in one of the meetings, and their biggest so cost is not the problem. They have money basically, but the thing is, anything that touches the workflow is a challenge for them to implement. because they have to go and tell every pharmacy, retrain all the people, put the work, process in place. And that's a biggest headache. So they will not consider any solution that changes the work.
Yeah.
So they have a very disconnected view of the world, basically. They want to innovate, they want to change, but they do not want to change. Now, how are you going to help them? So what we talk is, okay, they will eventually come to terms when they see this being applied by the early adopters, the independence, and they're using it, and enough people are using it, then they will automatically feel the pressure of somebody in their management structure saying, hey, they are doing, why aren't we doing?
And
And then it will seep down to actually doing it. So you're not going to be able to make them do it. They will have to do it themselves.
They want, yeah. So I've been doing, I'm trying to reach out to customers to talk to them for like 3 weeks already. Yeah, I only have like 3 pharmacy owner, able to
Respond.
3.
How are you approaching them? Are you approaching them like what's your pitch, I guess?
Okay, so I'm approaching them by mail, emails, and phone calls.
Yep.
And I'm currently working in an independent pharmacy, and I know my pharmacy owner. Yeah. Would you want to leave a message? And I'll get back to you later. What that will have happened. So yeah, that's challenging. But currently, I'm thinking about LinkedIn. So and I'm using like a lot of. I just found out that a lot of pharmacy owner in Massachusetts graduated from like my school. So yeah, but I asked my school to put me in touch with them, but they have some restriction about like they're not allowed to disclose their the alumni's contact information.
Like they don't have like an alumni director or something?
No, they do have, but they're not allowed to give like me the personal contact.
No, but there are many ways to break that. First of all, the alumni, some other alumni can operate on your behalf without revealing who you are. Okay, so like you can go up to one alumni saying, okay, through them contact, whatever. That's one way. Second way is a faculty member can participate. Alumni office itself can support. Basically, they know the database. They can contact and ask. They don't have to go and explain or sell anything. All they have to do is ask that other alumni, hey, you got a person who is interested. Would you like to talk? If they say yes, then we'll connect. If not, we won't connect. That's it. So that's all they have to do. So somebody has to sit down there. I'll send an email. They can send an email saying that we have an alumnus who is interested in these things. Can you please, if you are interested, please reach us out and we'll connect them. So they can make that matchmaking, which they will mostly do. But they will not give you, but they will ask somebody else if they are interested. They will give your number to them and say, have you contact. That they will be able to do.
No, but a resource. Alumni directory, it's like networking, but with cheat codes. It makes things so much easier. People are just a lot more receptive.
Right.
In general, so.
Many times, alumni association database is there, but they don't give it away easily because they want to protect. They don't want everybody contacting every alumni all the time. Even MIT, for example, they will ask you, who do you want to know? Then I will make the connection. Usually that's what they do. Unless I feel
like it shouldn't be that way.
Yeah,
but
in the case like alumni, MIT alumni, for example, you don't go to the alumni office, or if you go to the alumni office, ask for the chapter head, chapter liaison, and then reach out to the chapter liaison who will broadcast to the people. Right. Because that is typical. Different chapters are different. Some chapters are very dormant, no response. Some chapters are very aggressive and open and networked. So that's how generally we do.
Or sometimes it's even more direct. Like MIT also has a website you can go to. Right?
Mm-hmm.
Yeah,
you can just go to a website, type in someone's name, and you get all the contact info.
I don't think
so.
I don't think
no,
so.
That's, I don't think that happens.
You're not getting it.
For MIT, absolutely.
No, MIT. I mean, you can guess their email address, at alum.mit.edu.
Yeah, Harvard changed the email so you can't guess people's emails anymore.
Yeah, a lot of big companies do that too. Like Apple, that's why Tim Cook got like a ton of emails for it eventually.
But my email over Harvard is like 3 letters and 3 numbers, and they're just random.
Really?
Yes.
But the thing is, no. If you have a legitimate need, they will help you.
Yeah.
But they will be the keepers of it. You have to go through them.
My first email at Harvard was H. Gargi, which is my first initial last name. And that was like when Harvard had their own Unix-based email system that their own IT department maintained. And then like, all right, you know what, this is too much work for us. So they outsourced all the emails to Google. And so now we have like a Gmail address, but our email addresses are randomly generated. So if mine's HEG378, and like there's no way someone would be able to like randomly guess that.
MIT does better. The alumnus have a email for life kind of stuff.
Yeah.
And you select your email, but if your name is already taken, then you're eventually, as late people come later, will have difficulty getting a name they want. In which case you have to guess.
We have some latitude. Like mine is my last name, my first initial, my middle initial. So
Yeah. So for me, I used my first name. It was available at the time. As soon as I asked for it and I got it. Mohan. So basically, it stays there. Nobody's going to use it. So I mean, it depends. But if another person with my same name comes there, they can't use my name because if they use it, I'll get their emails. So they will probably use some combination thereof, and you have to guess.
Ohana too.
Something like that. But the thing is, ultimately, regardless of whatever the name email is, the alumni office wants them to be in the middle and they want to filter it. They want to see if you're a legitimate user, then they will give access. They won't restrict you from saying, oh, we won't allow you to contact
Yeah,
everything, but they have a legitimate use.
I know at Harvard, if you're an alumni, you have access to the alumni center, and you can get the name, phone number, and email address of every single alumni at Harvard.
If you're a Harvard alum,
Yes.
okay, then
I'm
what?
telling you, dude, like the same thing
No,
exists.
But you have to do it from like a particular location. Like you can't access it from like an offsite location, like a remote. You have to walk into a Pacific office and then do it that way. Yes.
Really?
Yes, because they want to make sure like that like who are people that are alumni at Harvard? Mitt Romney, George Bush, Jamie Dimon.
So, but George Bush cannot access the alumni directory unless he comes physically to Harvard?
Yes.
Makes sense.
And that's the policy that.
Okay, all right. I mean, who is going to argue with Harvard? Harvard policy and Harvard policy.
Also important.
Whatever. But it's easy. I
Let me ask
mean,
you, going back to the question. So what are your initial stumbling block? Identifying some key pharmacy where you can present your ideas, or
Not present. No, I'm not gonna present the product yet. I'm just gonna study them.
just study them. So can you
to-
going back to this? Can your school facilitate, since you're are you in school right now?
yeah.
You are.
Yeah.
So can your department facilitate, saying, we have a graduate student, blah blah, who's interested in automation,
Yeah.
whatever XYZ.
So I emailed
There
them.
will be.
I mean, that's my initial thought, but they told me to get on LinkedIn and just try it first, then get back to them. Yeah. So, I thought they would be willing.
see, the thing is this. Suppose there are 100 pharmacies or pharmacy owners. First step is not to sell, not to push a solution, but to find the need, assess the need.
Yeah.
So he doesn't need to talk to all the 100 owners, maybe 10 owners, because then you'll get a good idea of what the need is, real need is, and the extent of the need. You can guess for 10 to 20 people, you can guess.
Yeah.
That's all he wants. That the university can help. Pick the people, your faculty member, get a faculty advisor.
Because I'm thinking about like 50 pharmacists.
Sure.
Yeah. So
Okay. So one of the things you should do
to
is
make sure I
find
will
find a faculty member in your staff and ask them to be an advisor to your company.
Sorry, say again.
Advisor.
As an advisor to your
Who would
company.
be my advisor?
Go to the right faculty member.
Faculty
Choose a
member.
faculty member.
Oh, professor.
Yeah. Pick a professor, okay, who is connected. Ask him to be an advisor to your,
Yeah, I have to write
company.
out. Yeah.
and then he can write a form letter saying, I have a student, okay, who is interested in finding the needs and understanding the needs of a project. Make it like a school project.
Okay.
For a school project, we need him to get this
From the
information.
workflow, whatever the
Whatever
word
it is, he's going to ask you a few questions. Will you be available? And if he signs,
Yeah.
now we make it like a school project. since you're already in the school,
Okay.
okay, independent project, and he signs off. And that letter is mailed to 50 people,
Oh,
60,
yeah, I
100
see.
people, 200 people.
Right.
Many of them will respond back because of the credibility of the institution
Right.
and say, yes, we will talk with them. Then call those people and talk our 30 minutes, whatever it is, get all the questions answered. You so much so that if you collect the information and write it, you might even write a thesis on it. Who knows? And get some credit for it if you want. But make it a school project.
I mean, what kind of professor would turn out a citation? You know?
Yeah, you can publish it if you
Get on
want.
another paper, seriously.
Yeah, no, that's a good point.
That's how they earn rent. So
You are doing the work. He's just signing his name, once maybe, just Xerox 50
he's not
times
actually
and
doing the work.
put the thing there and type his name. But he writes once and gives you the letter. He blesses it, and he's a part of the story, and he's part of the advisory board for the company. Kind of story you get. Now that's a sweetened deal that you're giving him, and most professors will come for it.
Yeah.
Okay, so that way you can get all the you don't try to call them one-on-one. Instead, you just put there and put in a mailbox, 50 cents stamp, mail it,
Okay.
or email if need be on his name. But it's coming from your school address, and it gets response, and you get the response back. That's one way to attract people.
Right.
So if your credibility, use the professor's.
But once you get the professor on board, then try going to the alumni association.
Yeah.
Because then they would probably be like, oh, well, if a professor is endorsing this,
Right.
then we'll send out that email to.
Yeah, and here pharmacists do for sure. His fellows are like pharmacy owners.
and you have to be like consistent. Like I'm gonna need X, Y, and Z. Like it's for a good, legitimate purpose. I need it for this exact purpose.
Yeah.
Because that's our job. Our job is to connect people. Right?
Right.
It's the alumni association. So
So definitely, yeah, professor would be helpful. That's great. Thank you. I will try this one. Yeah.
What about you? Any of your pain points?
Yeah.
Do you have any
We'll
ideas?
move to another. Yeah. So you ask him.
No, yeah. If anybody wants to talk about any of their projects,
Any idea?
available.
I don't have any projects at the
I mean,
moment.
I'll just repeat what I said a long time ago, like one of the very first times we discussed this. What was you have to like quantify the cost benefit analysis of how much each one of your particular plans are going to cost,
Mhm.
and how much time and money it will help them. It'll help the pharmacy save, because at the end of the day, that's how you're going to solve it.
Yeah.
Like, okay, plan A will cost, $15,000, but it'll save you $20,000 a year. And this machine will last you,
Right. I will also.
5 years. But not only will it last you 5 years, your productivity will increase if you handle a large number of customers. Something like that. I mean, at the end of the day, you're a salesman, and you have to sell this.
And subscription.
There are
could be
a few other projects. There is, you're not able to read it properly. There is treatment bed finder, which we talked about. There's opiate relapse prevention. Anybody wants to talk about it? We have choose. We have many projects, so we can pick a few. Fall prevention, patients falling down. How to prevent that? That's a big problem, because that leads to many issues.
You can just pick an app with, like an Apple iWatch. They have motion sensors in there.
I mean, if we can talk about any one of them. I'm just going to the list and see which one you like to talk about. We can look.
Is that trying to solve a problem in like a hospital or just in general?
Well, hospital in particular, in general. Okay, so basically, fall prevention is like this one is actually a device. A person is working on it. It's like a strength training by adaptive knee braces. So he has loss of muscle mass and tone of quadriceps muscles occurs in senior people with chronic arthritis of knee joints. Our smart knee brace helps improve muscle mass of quadriceps muscle by a resistance training. So this project is a brainchild of a person by name Shivam, who is a Dartmouth student. and he has been working on this. He's sort of a very personally interested in that, and he's been doing this. So this person, Shivam, and he's an engineering student. So his prototype initially looks like this. He built something similar to this, and it's something like a brace that can be put on the knees so that it provides a strength so that person doesn't fall. It just sort of adds more strength and something like that. Then that's the first prototype. I think later on he built more better versions, 3D modeling stuff. He has done that plastic stuff that sort of ties better clamps, better kind of fit that he has done that. So that's something he's working on. Any thoughts about how it can improve? Have you seen this? You might have seen firsthand these issues.
Yeah, I mean, I know these are really big problem for in elderlies because they're falling over time. And for example, one of the main surgeries, orthopedic surgeries, are hip replacement because these elderly people fall down and break their hips. So yeah, sure, it's a really good idea. And the only thing is that maybe he needs to make it easier for the elderly to use them, because not every morning they want to get up and put on a device so difficult and so big. I don't know. Yeah. So that will be. I don't know how. I'm thinking about it right now, but yeah, that will be one of the things we should solve out.
Okay. So do you have any first-hand experience with these kind of things? Do you have experience with these kind of things with the patients?
No, with building devices like this. No.
Not devices, but I'm saying the problem itself.
Yeah.
What are the challenges that you think that?
I mean, when the people start aging, they start losing balance. They start losing of course, you can start compensating with a cane, for example, but all people fall down because, for example, they forgot to use the cane that morning. They want to go to the bathroom, to wake up in the middle of the night, and they forgot to take the cane, and they fall down, and then their hips break.
But I mean, if somebody forgets to pick up a cane, how are that person not going to forget putting something on?
Of course, this is easier.
It's easier?
Maybe, but
what can be easier than just picking up a cane?
I really don't know. Maybe if they just attach it every time, but that's the other problem I'm talking about. How you make attractive and easier to use a device like this instead of a cane or a walk assistant. Yeah, I don't know. Because maybe this could be a substitute or prevent because it increase. I mean, I don't know how it works, but maybe that it improves the balance or the.
Okay.
I think he tried to express a different problem. I'm not sure.
Is it just a physical device, or does it have electric stimulus?
Oh, I think it's just a physical device.
Just a physical device.
Yeah, just a physical device. I think its new model is smaller and simpler, and you can just put it there. And whether somebody can put it and leave it on for extended period of time, I don't know what the latest status that he has it, but I know that he has a different kind of a model when he has made more.
It has to be more comfortable.
Yeah, lighter, yeah.
This is something in a crude physical model that he put it together.
I'm listening because I know someone who's in his 50s because of cancer. He kind of not balanced. So, but he hates to use the cane because then I'm not that old enough to use the cane. It's something like this that gives them a support that you can wear during the daytime instead of using the cane.
Yeah, maybe.
Question is how easy it is to put on.
Yeah, but by using it, a patient can fall. Still can fall, but the cane is, prevent a patient from falling.
Falling, okay.
Yeah, right. But this one, cannot replace that. Yeah.
It doesn't replace the cane. You're saying they still need the cane. You just help them.
Oh yeah. I yeah, I think so. The innovator is not here, so
Yeah,
yeah,
it's not,
I'm not
it's not
sure.
here.
I think he trying to address one issue like
Just
chronic arthritis of knee
Yeah.
joints,
Mhm.
and it can be gone after using this
Yeah.
this thing of period.
I think, for example, the kind of atrophy, the concept his mother's uh, atrophy had was because of the misuse of the muscle. I mean, she had this arthritis.
Yeah, I think that's what he
couldn't
means. Yeah.
exercise well, and that's why the muscles are.
Where exactly? Which part of the body is the most vulnerable? Is it the whole leg or is it only
No,
a,
for instance, it's this muscle.
only a small portion? About a foot long, maybe?
I don't know. It's a really big muscle, but in Belgium, it's the biggest muscle in the.
But about the whole length is about a foot.
Yeah, the whole line. Yeah.
Yeah, about this side.
Yeah.
This side.
So if you have a device that can just fit in there permanently for a long period of time, that should work, right?
Oh,
No, but his yeah.
Huh?
What are you trying to do?
No, basically I'm trying to, this is crude, first version, but it's something that, simple plastic that can be made, which is resistant and applied there, basically. And it stays there, somebody can put it there without taking it off every time.
But his goal is try to like help the patient use this one after a period of time, get rid of it, and the patient is able to walk normally.
This is still true,
Yeah.
still true, but
To
yeah,
build up the muscle.
yeah.
Yeah.
So
that's
if
what he's trying
somebody
to do.
has a device that they wear it for a couple of weeks, then they can take it off and the body has gotten the strength already. So it's basically resistance training, right? That's what he's training.
Yeah, he's trying to help a patient.
So
like, try to build
a sort of a cast which puts a resistance. So the person has to move. They have to resist the cast, for example. But at the same time, the cast provides the strength so they don't fall.
Right.
And it also gives the resistance so that the muscles get developed against that. So they don't go around doing special physical training. It is there and it pushes it against them. Every time they walk, it is exercise, basically, physical training.
That's important. The exercise part.
So they can walk. So it's not like, they are not in control because that's giving the rigidity and the resistance. And after some time, they can take it off, basically, without any problem.
Yeah, for example, I think maybe the target of these guys should be the people who have arthritis. Okay, because maybe the device can, as you say, make them do exercise and stop the part of the outfit. So maybe the target is not the all the elderlies who are falling down and just these group of people. So it's different because I really see I think it's really difficult to say a man who is 80 on his 80s to come on wake up every time you need to stand up and put on a device.
Yeah.
It doesn't really matter. It's
doesn't
really
work.
small, but it's difficult. I mean,
Right.
it's hard.
No, but if a patient comes to the hospital, elderly patient, we can have this cast available, this kind of special cast made. And it's already, the person, so long as they're in the hospital, they're going to wear it. Periodic changes perhaps, but they will wear it.
And that's
And
a
that
really
means
big problem.
during the hospital stay, at least they won't fall down because this will provide the resistance and rigidity.
I mean, but this is a really big problem. People falling down in the hospitals.
It's one of the problems. Well, they're falling down is a problem.
Yeah.
More so if it is in the hospital, because then the hospital is responsible for it.
Okay, get it.
I
I
mean,
think what he was asking is that while it is a problem, is it a common occurrence? Like, are people falling down often
Oh, yeah,
in the hospital? In the hospital.
for hospital also, yes.
Okay.
Yes. But if they fall at home, it's a different, same problem, but in a different context now. But if they fell in the hospital, I understand how often does it happen is a question.
Yeah.
But if they fall, even if it's one person falling in the hospital, then hospital becomes liable. That is a big issue. So that's why they don't, I mean, they want to avoid it absolutely. They want to avoid people falling in general. Definitely they want to avoid falling in the hospital. They don't want anybody falling in the hospital. So that's what I think, that's what my understanding of the problem is. maybe that's a different way it can be done. Okay, so this is one need, and this one problem we're doing. Another one we are doing is Alexa extended electronic medical records. This one, I don't know if anybody is interested here. This is basically a natural language processing. So instead of Cal will come back, I think he's going to sign up his Airbnb guest. And he'll come.
It's business.
Yeah, yeah, but when they come, he has to be there to let them in and all this stuff. So, but yeah, I think he'll probably come once he's done that. Probably take about 30 minutes. So this one is the doctors are spending time typing the things in the computer when they're talking to the patient. It was very difficult. So basically an Alexa device that records and translates that into a natural language and enters automatically into the electronic medical record. So that's one of the projects we are working on. And any thoughts on that? Yeah, totally.
Yeah.
Okay.
But
Okay.
like sometimes we can translate into like wrong.
Take
It might create
make
mistakes.
a record. Because when you start asking questions, maybe you need to be really fast and make a really good medical history in a short period of time.
Yeah.
So the Alexa can fix it.
Other one is narcotic addiction. We talked about.
I mean, the electronic medical records have really driven up healthcare costs because for doctors to be able to be productive, they need to be able to continue to speak to the patient and interact with the patient, but they can't be distracted to the point where they're typing medical records. So a lot of hospitals have now given each doctor a scribe that works as a personal assistant for that doctor.
Really?
Yes. Yeah.
That's so efficient.
So like one of the facilities that I go to, every single doctor has a scribe that's in the office with the doctor when they're in the office. So whenever the doctor's seeing a patient, the scribe is always there to take the notes. So the doctor asks the patient a question. The doctor's seeing the patient face to face, just like they're talking to me. And on the side in front of the computer is the scribe that is typing in the notes for the doctor. Or like when the doctor's doing an examination, like for example, I have problems with my eyes. So the doctor may be looking at my eyes and they say, okay, this and this with the eyes, and the doctor doesn't need to step away from the examination. They're just saying out loud whatever needs to be typed, and the scribe types it back in. But it's allowed for efficiency, but again, it drives up medical costs.
The question is, what happened with those? Many years ago, we used to have the computer voice recognition where you speak and computer already.
That's what this is.
Right, yeah.
Yeah,
So
but
the
those
question is, why do we need to scribe? That's what I'm thinking now with all the technology of voice recognition. Why do you need a live person to take this?
Because one, it's not very accurate, and two, you need to type in that information into different areas into a computer. So you need to put one application. You may need to put in, okay, blood pressure in this one particular area, weight in this particular area. These types of tests in a particular area of the form for
It becomes a data.
eventually, someone will develop some sort of artificial intelligence that says, okay, whenever the doctor says the person's weight, okay, it goes into this particular. I'm just making stuff up. Obviously, you have nurses or techs that do all this stuff for the doctors before the doctor sees a patient. So the doctor doesn't have to do that and waste time doing that. But I know, because I have problems with my retina and my retina, my cornea, the back of my eye, they need to examine all that stuff. So the doctor's looking inside my eye with a microscope, and they don't want to get up from their seat, to go back.
To me, we're just thinking having a person emphasis of artificial intelligence.
Yeah.
Why would you have a live person with cost constraint and everything else?
Yeah.
Especially here in America.
Because of the different fields of entry. So if you put one and fill in one blank here, the next blank has to go somewhere else.
That filling the forms in
Yeah,
already.
I
I
know it has to
understand.
be with the form.
But taking the notes, like if the doctor sees your eye or whatever it may be.
But then who's going to go
See,
through the
the
notes?
thing is this.
Yeah, the note.
The thing, I mean, my personal feeling is I like what you're saying. You know, have another person there who enters the date, enters all the information as an invisible scribe sitting in there. To me, it has a lot of value associated with that because it's some simple, extensible, scalable, everything else. This one, you know, is also, you know, scalability. You put another Alexa machine sitting there, and the advantage of this is the devices like this is that there's no other human being. So people may be unwilling to discuss something of their problem when a third person is there. Which, you know, it's not a doctor. Even if the person is just typing as a preference, may want, what is a person going to say, and the reluctance
They
of
might be uncomfortable.
the uncomfortable saying that. So that's one problem. That this might alleviate, for example. Another thing, I think most of the reason why these are happening is because we, as a human nature, is we want to make automation. We want to do fancy solution. We don't want to touch your nose this way. We want to do it and all sorts of things. And
Yeah.
so we want more complicated
Because we
electronic
can.
computer stuff. Doing, I mean, like that
I-
kind of fascination is what is driving most of it. But this has added advantage that it is first private. Go ahead.
To be honest with you, I mean, I kind of like the idea of having a scribe, because that way I can talk to the doctor and have the doctor focus on what I'm trying to say. And then if I need to say something confidentially, I'll say, hey, I need to talk to you confidentially about this, and scribe will step out.
You sound like a pretty confident person. Like if someone's like very reserved and socially awkward, like saying, "Hey, I don't want the scribe here," might be too much of a
barrier.
Yeah, that's pretty common.
I mean,
Someone-
imagine if I say, look, I want to talk something to me in private, can all of you leave?
As a doctor,
No way. I'm not going to, it'll have a lot of resistance. I need to be really, really confident to say that. And it might be offended, you don't want to offend.
as a doctor, you have to create the environment for the
Right.
patient. The patient don't have to ask
Right.
for the environment.
Right.
So
I'm more scared about this Alexa stuff than having your personal information.
Oh, yeah. No, I'm not.
Look. have you
I
seen-
like the simpler solution, human being solutions always.
I mean,
Anytime.
I'll be quite frank. Have you seen what Facebook has done recently? Anyone that has installed a VPN device on their cell phone, Facebook has gathered all that information from the VPN device, because that VPN device knows exactly which app you've opened, how long you've opened it, when you've used it, who you've called, who you've talked to, for how long you've talked to them. And Facebook has used that information to develop and enhance their Facebook platform and to be able to compete with other companies. And it's not just, Facebook, it's Amazon, it's Microsoft. Microsoft now has in the end user license, what is it called? EUL?
EULA. EULA, end user license agreement.
Okay. And they have you sign off on certain information being sent back to Microsoft and how you use Microsoft
Mhm.
Windows. It's between Google and Amazon and Facebook and all of these other data brokers. I am extremely reserved about anything that is automated and connected to the internet. I'm more scared about this stuff.
No, I agree with you. I also believe the same kind of thing, particularly in the medical records. When you have interconnectivity, I cringe at it. The more not interconnected, the better for me for privacy point of view. Because if you want a second opinion, you go to your first doctor, he gives something, he types the record. You go to the second opinion. You think you're going to the second opinion, but the second doctor can see what's in the first one, and they can be influenced by that very easily, right? So, I mean, if the first doctor happens to be a professor and well-known figure, the second guy is not going to come and say something contradictory. And for me, the best antidote to this kind of a privacy issues is inundate the system with garbage. Just garbage, lots of nonsensical stuff, inundated with that so that the overall reliability of the data comes down. Okay, so you have 100 gigabytes of garbage there, of which 1 gigabyte is useful information. So if I know that somebody is doing, I'll keep calling everybody in my phone. In a VPN, I can call 2,000 numbers. Now every number is typing. I'm going to everybody, so they cannot figure which number I really want, which number I don't want, based on my record. If everybody did that, then now Facebook has 200 billion records, of which 199 billion records is garbage. So their whole system of accurate data mining is going to be totally off track. That's what I tend to do.
To me, at the end of the day, I base my decisions on being very, this word has gotten a very bad rap, but I'm very pragmatic, right?
Mm-hmm.
If it's going to work or if it's not going to work, and it's going to work based on how people behave. I'm like I've come in here before and I say I don't believe in political correctness. I know how people behave.
That's what I'm saying.
And
only if your behavior is predictable, then a human being or a system can predict it. But if your behavior is unpredictable, totally erratic, then no computer program is going to figure out that you're being erratic, because somewhere in the erratic is the sense, but you're adding garbage to that.
Correct. But okay, fine. You make
They're
it,
talking about interesting things, the behavioral stuff.
but you may be adding garbage to your data, but at the end of the day, how many other people are going to do that? Right?
Fine. But for my data will not be available. My data is not going to be reliable.
But
that's it.
My data will be available, and so is yours.
Because you're using the way they want you to. For example, in my email account, okay, I use about 100 different emails. All I have is a domain, one domain. Everything else is random. So I can, if somebody says they want my email, I can easily give my email, any email I want. I will see that email. It'll come, and I get a lot of junk. I don't do any spam filtering. So it's all emails. But so if Google wants to find my email, there'll be 150 emails. Welcome. You can try. No, you cannot identify me based on what my behavior is.
So you're the anomaly at
Right.
the end of the day.
No, anomaly, agreed. But I'm saying that the trick to protecting privacy is anonymity. Like open source does it all the time, right?
At the end of the day, this device will pick up everything that you say.
Yes.
There will be information that's entered into the medical record that the doctor may not want to enter in,
Yes.
or the patient may not want to enter
Yes.
in. And it's going to raise privacy issues.
You're absolutely right. This is not. I think there's got a lot of technology has inherently a lot of problems. Inherently, that's because you're dependent on everybody using it to be above board, honest, and nobody is that honest.
And to be honest, and to be very clear, no one is going to do the morally right thing when you can monetize a particular transaction or a particular activity. This is what has happened with Google. This is what's happened with Facebook. Google swore up and down, left and right, in every single which way that they were not reading emails when the state of California wanted to pass legislation preventing IT firms from collecting that sort of data and preventing email service providers from reading email. Google swore and told California legislators, no, we are not doing this. And they were doing it at that exact same time. And
I cringe about Gmail. When I send information, if it is going to the Gmail, I worry about it because it's going to the archives, and somebody can do data mining. If I do sensitive, even information about our ideas, IP, whatever it is in Google, Gmail's direct, and somebody in Google can easily look at it and easily read what we are doing. Nothing. For me, I have my own domain basically. Yeah, it goes through multiple servers and may store it, but ultimately it is not going to Gmail. It is in my domain.
Because I'm not an IT person. So
I have my
one email address.
I have a domain. I have a domain, msvi.org.
Right.
I have my domain msvi.org. It is hosted by my server somewhere, and they manage it. And I collect all the things and I don't delete that stuff on the server. So it's on my machine basically. And as I said, I don't do any spam filtering. In fact, spam helps me little bit better because if I get spam, that means my server is working at least. That's all. And it's sitting there. I'm not even deleting it. It's a waste of time even trying to figure which is spam and deleting and all this stuff. It is sitting there, no harm. Just scan through and only things I want to pick. Remaining the rest of it, fine. I don't care. I mean, basically, you can't fight the logic there. But again, spam creates that understanding that a lot of garbage makes you anonymous. Only the emails that you want to pick, but Google doesn't know which emails I'm picking. You can answer it and put it on. It's Kalyan, yeah. Probably Kalyan.
Which one?
Hey, Cal?
Yeah.
Hey, we're on our way.
Oh, thank you.
Okay.
So anonymity is like open source did the same thing. Open source said, when Microsoft said we want to license the technology, we want to know this and we want to do this. Open source said, anybody can copy it. If I want to make a change, I make a change and copy it. If nobody can copy it and use it because everybody knows everybody is open, basically. So there is a protection in anonymity. In common knowledge will automatically protect your privacy.
And then the thing is like,
Hey, Matt.
like if someone can gain access to your records, they will.
Yes.
Like Google has gained access to medical records because they're saying, okay, we're going to try and do this and this to improve medical care.
Exactly.
And people said, okay, we're going to try to anonymize this, but at the end of the day, you can still identify people.
Yeah.
I mean, and it's not just Google, like every single company. Like Uber wants to know where you're going 5 minutes after they drop you off. They will track you for a total of 5 minutes after you get out of the car. They say it's so that they can enhance their service. They want to know where you are 5 minutes before you get into Uber, and they want to know where you're going 5 minutes after you get out of the Uber car.
That doesn't make sense. I don't understand why they would want that information.
It's about understanding the customer's journey. When you understand the customer journey, then you can have an opportunity to sell stuff, advertise stuff.
You can tell the companies in the area, business in the area, this many people are coming to you.
Yeah.
And this is where they're coming from.
Yeah.
So for example, if you have a business, if you have business and you have 100 people come to you from Roxbury, then you might say, why don't I put a location in Roxbury so that I can do my business? So from a business, I'm giving an example. For a business, it's very useful information and they will pay for it.
Yes.
And how are the Uber selling that information? They're taking information from you, but you as a passenger don't get any money out of it.
Yeah.
But they're getting your information selling and they're making money.
I mean, basically, Uber
You're losing your
knows-
privacy, basically.
Uber knows where you are 5 minutes after you've walked out of that Uber car. And I think, there was some concern that they were tracking you all the time. And so these companies have pushed further and further into privacy. I mean, if I was a politician and someone came to me with this particular idea, I would say absolutely no way. I mean, I'm as conservative as you can get. I've told people, look, I make the Tea Party look liberal. I'm a big, huge Donald Trump fan. But,